go into the proposal of dark sectors. Are those the ones that the standard?
So cute.
Yeah, yeah. Yeah. It's so like it just every time I see it on anything, it's just I love it. And I think it like fits our vibe of like let's do this, let's have fun, and let's like, you know, be memorable and like make people happy. So
There were some that were just kind of loose and unstapled that I took out of the stack.
Oh, okay, so this is extra.
Printing.
yeah, yeah. I didn't think about like that. So, well, maybe it's a year two. It's a year two.
A future endeavor. Oh, is this, did you bring this for me?
No, those were ones I pulled from the stack because they
Oh.
complete and didn't have staples. So.
Oh.
I should probably take this off in case
I
I
don't know if the printer was fast. I don't know what to do.
probably.
Well, it might be the last one because I told it I was going to have it print 20, but then I'm like, no, we just need 10 because we always recycle it 10. Okay.
Ooh, is this the creepy eye room? Or did they finally take the creepy eyes out? Because I know they were getting rid of those.
I think that was the
Okay.
dividers for sure.
Yeah, I know that.
It
I
does
know
have
they're
the
like,
old hockey puck microphone thing, so
oh
I
yeah.
don't know if this had the
5, 6.
Big Brother on.
Big Brother's back. I'm so excited. Really? Oh, it's good. I think Big Brother sparked my interest in reality. No, I take that back. Real World sparked my interest. Or actually Road Rules. Road Rules is what started it for me. Because Road Rules was a little more when I was that age.
I like road
When that
rules.
was on.
The true story. True story.
Two, 9, 6, 5, 8, 7, 6, 2, 6, 9.
Oh, right. SPM topics.
Yes.
There's a lot of wasn't sure if I was delivering any.
So Dorcita's doing the first 5 slides. So, 1,
Because then after that,
and then I'm doing 34 through 39. And then Misty, which slides are you doing?
It's only like 16 and 17. I can do others if needed.
after they got incorporated.
Oh, just the training sides. No, there's like 2 training sides.
Oh, so maybe all these soft launch slides.
Can you please just work?
Oh, so okay, so she's doing just these ones.
Jason's gonna say.
Room is unmuted and the camera is on.
Good morning, everybody. Welcome. Those who could join us in person and those online joining us today, welcome. I'm Michelle Temperley, interim chair. Welcome to the HIMAC Advisory Committee this morning. We could proceed to the next slide. Welcome. We're going to echo. Double mic. We got it started. One of the two. There we go. Sorry for the technical issues, everybody. Thanks for holding in there. Welcome. We're going to have, as we take roll, we're also going to introduce ourselves and everybody in the room. But thanks again and welcome. We could possibly proceed to roll.
Okay, Dan. Okay, sounds great. Good morning, everybody. My name is Chicky Flowers. My pronouns are she, her, hers, and shakaya. And today I am in the room. I'm not entirely sure. I'm waving my hands. Maybe you can see me. For those in the room, I'm wearing a dusty pink dress. I'll just call it that. I was going to go fancy with mauve, but dusty pink sounds great. So for the roll call for the HIMAC committee members, if you are in person, just let the kind of our virtual attendees know. And if you are joining us virtually, if you can let us know. If you're joining by camera and or by phone only, that would be fantastic. All right, so starting with Marin Ariola.
Marin Ariola, Salem, Oregon, in person.
Thank you. Stacy Carmichael. In person. Charlie Fisher.
Good morning, Charlie Fisher, remote.
Thank you, Charlie. Good morning, Ron Gallinet. Paul Harmon.
Paul Harmon's here, virtually.
Thank you. TK Keene.
Here online, thanks.
Kathleen Borg messaged us that she is not able to join today. Claire Pierce-Roble.
Here, virtually.
Thank you. Om Sukinai. Sorry, can you repeat? I think I heard you, but I caught the last end. Are you here virtually?
Virtually, yes.
Okay, thank you. Nishoba Temperley.
Morning here in Salem.
Matt Woodbridge.
Morning here in the room in Salem.
Thank you. Elena Zbirin.
Here virtually.
Thank you, Elena. And so interim chair Nishoba, we do have quorum for HIMAC committee members. In the room, because we have quite the attendance from our team members from Oregon, so I would like to do a quick round of introductions. If you can just introduce yourselves in the room and then your kind of working title, that would be fantastic.
Cheeky, it's Ron Gallinet. My apologies, I got my microphone to work. I'm here virtually.
Fantastic, Ron. Thank you very much for letting us know.
Dawn Shaw, with Marketplace. Amy Coben, Communications and Public Engagement Analyst.
Victor Garcia, Operations Advisor and Program Liaison for Marketplace.
Good morning, everyone. Misty Rias, Marketplace Deputy Director.
Chicky Flowers, Marketplace Director.
Liz Mel, I'm the Business Operations Budget Manager. And Steve Stiebler, the Project Analyst for OHIM.
Hi, everybody. I'm Katie Button. I'm here in the room, but I'm going to turn my camera on because I'm not visible on TV. I'm the Plan Management and Policy Analyst for the Marketplace.
Okay, good morning, everybody. Jason Sparks, SVP of Delivery for Get Insured FEMA.
And then Claire Howderman, Project Lead for the Oregon project from BMO as well.
And that concludes everybody in the room. And for those virtually staff in the virtual environment, if you can please identify yourselves in chat, that would be fantastic. And then we can move on. Next slide, please.
Great. All right. Thank you, everybody. Just wanted to remind some folks about the meeting protocols and some of the requests. And that the HIMAC committee is committed to a safe and inclusive meetings for all attendees. We might have differences of opinions. There's no bad ideas. Please let your voices be heard. Please speak up. We'd love to hear your perspectives by inviting each person to speak. If you have a question, you'd like to comment, please raise your hand in the virtual space or here in person, or please put your question in the chat. Looks like we do have some interpretation services that have joined us, so please try to speak at a moderate pace and be on camera as much as often as you're comfortable, and please mute your speaker when not speaking. So please. And for transcribing purposes, please all of us remember to state your name before speaking, myself included. I always forget this one. Members of the public, requested to hold questions and comments until the public comment portion of the meeting. And if we're witness subject to any unacceptable behavior, please contact our Marketplace Director, Chicky Flowers. Thank you. Slide. And just a voting reminder, compliance with public meeting law As your name is called, please state your vote, as will be logged into the official meeting minutes. It can be accessible there. But hopefully everybody got a copy of the meeting minutes that were sent out just the other day. If anybody had questions or a motion to approve.
Make a motion.
Okay, thank you. We have a second.
Matthew Woodbridge, I'll second.
Matthew, thank you. Maybe we'll move to the Chicky too.
Okay, so we are looking for approval or not approval for the meeting minutes from June 26th. We had the first motion, it was from Maureen, second motion was from Matt. So Stacy, how do you vote for the minutes?
I wasn't here, so
Oh.
I feel like.
Okay, abstaining, okay.
Yeah.
Charlie, how do you vote for the minutes?
Yes.
Thank you. Ron?
Yes.
Thank you. Paul Harmon, how do you vote for the minutes for June 26th?
Yes.
Approve.
Thank you. TK Keen, how do you vote?
Approve.
Thank you. Kathleen is not here. Claire Pierce-Roble?
Approve.
Om Sukinai?
Yes.
Thank you. Nishoba, how do you vote?
Approve.
Elena, how do you vote for the minutes?
Approve.
Thank you very much. We have majority vote and the minutes have been approved.
Great, thank you, everyone. So we'll pass it back over to the Chicky and our guest Caleb to talk a little bit about proposed marketplace assessment. Thank you.
Thank you, Nishoba. So good morning again, everybody. Chicky Flowers, Marketplace Director. So at our June 26th meeting, we did a more in-depth presentation about the marketplace assessment and enrollment projections and all the fun stuff that goes into estimating needed revenue for marketplace operations. Next slide, please. So I'm hoping to do a kind of a high level, maybe an abbreviated version of that presentation. So especially for those that were not able to attend last session. So what is the marketplace assessment? It is the fee charged to health insurance companies that sell plans through the marketplace. It helps fund our operations, which includes our consumer systems, our technology, our program administration, policy development, and especially outreach and education. This is used to help ensure Oregon is compliant with federal provisions and requirements for the exchange. Next slide, please. So the role of the committee per Oregon Revised Statute 741.105, the Health Insurance Exchange Advisory Committee shall advise the authority in establishing the administrative charge. The charge must be in an amount sufficient to cover the costs of grants to navigators, in-person assisters, and application counselors certified under ORS 741.002 and to pay the administrative and operational expenses of the authority in carrying out ORS 741.001 to 2.540. Next slide, please. Our current fee structure, Oregon's Marketplace, again, is funded through a per member per month fee on participating insurance companies. Currently, for 2026, federal platform user fee is separate from the marketplace assessment fee and is paid directly by participating insurance companies to the federal government. These are charged as a percentage of premium charges annually. So currently we have two charges that the carriers pay, one to us and one to the federal government. Starting in 2027, all fees will be directed to the state. Next slide, please. High level on how marketplace carriers incorporate the fee. Insurance companies must spread the marketplace assessment across the entire individual market, reducing the effective impact on any single enrollee. Next slide, please. And we are definitely committed to transparency, and we are doing so by charging a flat exchange user fee. So federal policy changes have negatively impacted enrollment, resulting in lower enrollment and higher costs for the state to try to maintain or increase enrollment. Our state relies on enrollment stability to sustain funding because unlike a fee based on a percentage of premium, a flat fee does not increase at the high rate of medical inflation. Healthcare.gov currently charges a percentage of premium. When federal policy changes increase premiums, healthcare.gov may maintain or increase revenue even if enrollment is negatively impacted. The perceived reductions in fees do not necessarily equate to lower federal revenue or reduced costs for insurers and consumers. Next slide, please. So let me pass the virtual mic off to Caleb Levon.
Thank you, Chicky. So in recent years, the assessment had been at 550, and then starting in calendar year 2026, because of the expiration of the enhanced premium tax credits and the implementation of the OHP bridge plan, there was an expectation that enrollment would go down this year for 26. So last year, the assessment was increased to 685. So that is the current assessment. However, that increase didn't account for impacts from HR 1 or the 2025 Marketplace Integrity and Affordability Final Rule. And obviously doesn't account for the transition to the state-based marketplace, which will go into effect next year. So next slide. So to cut to the chase, just to get right to the point, we do recommend an increase in the medical assessment rate to $35.60 and the dental assessment rate to $1.70. And that is a combination of decreased enrollment due to these factors that I've mentioned, and we can talk about those more, and also the costs of going to a state-based marketplace. So the assessment, the recommended assessment is chosen so that given the forecasted enrollment times the assessment, that equals the expected expenditures. So those are the components, the pieces that go into that calculation. Obviously, forecasting the enrollment for 2027, we have to account for those factors that are impacting enrollment. And we mentioned the expiration of the enhanced premium tax credits. We expect there to be some continuing. We don't expect the enrollment to bounce back now that those tax credits have gone away. They're not coming back next year, so we expect that enrollment will continue to be depressed because of the increased cost for consumers. Also, the transition to the OHP bridge plan, there are still people moving off of the marketplace into Medicaid, which now covers up to 200% of FPL. And also the withdrawal of some insurance carriers from the individual market that will occur next year. So those are some of the factors that go into it. Now I'll talk about each of those pieces individually so you can see how they individually impact the estimate of this recommended assessment. So next slide. Here we're looking at the expenditure. So those are the costs that the assessment needs to cover. And clearly the large increase in expenditures starting in 2026, but mainly in 2027, the expenditures are related, the result of the transition to the state-based marketplace. So that's the large increase in expenditures. So we have to, the assessment needs to be set to cover that. Next slide. The other piece of this is the estimated enrollment. We multiply the assessment by the enrollment to get the revenue that the assessment would generate. We create a baseline forecast using the recent history, just an exponential smoothing model for those that are particularly interested in the deep details of forecasting. but we have to add impacts for known factors that will impact enrollment, things that are not necessarily captured by that recent history. So we did see the impact of the end of the enhanced premium tax credits. We saw that in the effectuated enrollment numbers for January of this year. We saw a significant drop there. We've seen continuing decreases that we attribute to people moving to the bridge plan. We can see that the fraction of people with FPLs, that is the federal poverty line, that is their income, the fraction of people with income in that eligibility range that are on the marketplace has been decreasing over the last 2 years, presumably as they move to Medicaid. And then we need to account for insurer withdrawals, which there's 2 insurers that will be withdrawing for January 2027. So those are some of the factors that we do account for in the model. Now, there are other factors that we don't directly account for. Next slide, please. So these are things that certainly are risks. We know that they have some potential impact on the enrollment, but we don't have a clean way to incorporate them. Either we don't know, whether these things will happen, or we can't necessarily measure their impacts. We would not be surprised if there is additional federal action on Medicaid. That's obviously beyond my power to estimate what the federal government is going to do at this point sometimes. There's a shorter open enrollment period. There's continued market uncertainty that is in the healthcare marketplace with whether new carriers may enter, other carriers may leave. The feds can make administrative choices. And then, of course, there's the economic worries. There's always a risk of an economic downturn and the impact that might have on the caseload. If I could predict the next recession, I would be working on Wall Street, not as a healthcare forecaster. So there's always a degree of uncertainty there. We're cognizant of that risk and take steps to try to alleviate those in the forecast. All right, next slide. All right, so those are the steps that went into calculating that assessment rate. That assessment rate was chosen so that given the forecast and the expenditures, that assessment would cover those expenditures. So at this point, I'm going to turn it back to you, Chicky, to talk about this feedback request.
Sounds great. Thank you, Caleb. So HIMAC committee members, we would appreciate additional feedback on the proposed 2027 marketplace assessment rate. So just let me read this out loud to you. The ORS 741.105, again, it requires the assessment to be in an amount sufficient to cover the costs of grants to navigators, in-person assisters, and application counselors certified under ORS 741.002, and to pay the administrative and operational expenses of the authority in carrying out ORS 741.001 to 741.540. So you have in front of you a series of a couple of questions. It's not actually not a couple, it's more than a couple, it's a few. It's definitely in the range of three to six. So happy to go through these one by one, or if you all have a specific question that you have feedback already for, I'm happy to do it as well. Is there a specific approach you would like to do?
So G, excuse me, G. So what are the costs that the assessment covers besides the grants, or what are the costs that it's going to cover?
Yes, happy to. So I'm looking to, so Liz and Misty beside me are our business operations financial leads. So I will look to them to speak more eloquently and sophisticatedly about the
I
expenses.
will try. It basically covers all of our staff, all the payroll, all the expenses related to the staff, supplies that we need. It also covers, you know, if we need software or things like that. Obviously, that the SPM upgrade is there, and we also have some shared services costs. We have to, because we have, you know, we have a shared services area for accounting and other items that we have to pay for their time as well. So.
Does it also cover the grants for the CBOs?
Yes.
Because there's a concern in terms of that the grants are not keeping up with the cost of inflation. And we've had these conversations also with, in general, with the other programs. So for example, there's programs that have been funded the same level for 15 years. And according to the market analysis, the cost to do that kind of business now is 40% higher. So part of our discussion with the governor's office has been, we're not paying these CBOs sufficiently at a market level based on the work that they're doing. And so how do we make them more equitable? Make sure that whatever we assign the scope of work is assigned a level at the market rate for them to pay their payroll, their staff, the supplies, and we still have inequities in terms of this funding in general. It's a systemic issue. So what are your plans in terms of keeping that up? Because a lot of CBOs are having a hard time right now. You know, some are closing, some are having different challenges. And I'm saying it's a systemic issue all the way around. I think state and government.
Yes, so Maureen, so this is Chicky Flowers, the director. I wish I could tell you all of our grants will cover all the different gaps that we know exist with our community partners and insurance assistance agents. So what we do have, what we try to project is how our grants work is we project in a biennial basis of like how much we are able to have funds available to provide grants. And then we do a request for proposals, and community partners and insurance agents kind of look at that request for proposal and provide, again, obviously proposals based on the services that they can supply in terms of doing outreach and application assistance and enrollment assistance for market-based agents. So we recognize that this is a gap. This has been a constant conversation with our partners for the last 10 plus years, even as a state-based marketplace on the federal platform. So we aim to help them as best as we can, but obviously we can't always meet the gap. But yes, we are, at least I can say we are in constant conversation to see where we can make adjustments. So like, for example, one year we find out that we have a little bit more extra funds, then we offer it up to our partners and agents, our partners, assistants and agents, and then they again propose. And so we try to make it as competitive as possible, but also as fair and equitable as possible. So all that to say.
No, of course, and I totally understand it.
Yeah.
I want to make sure we acknowledge that
Yes.
space, because it is a challenge
and
for a lot of CBOs
yes,
to.
we recognize, especially every year it's different, like cost of living, cost of services increases every year. So we definitely try to make adjustments as best as we can.
Thank you.
Oh, sorry, and Misty had an additional.
Yeah, Misty Reyes, thank you. I would just say too, when we went through the RFP process this last couple of years, so we've had grants that were just being direct awarded, and we're like, we need to go back out for the process and see who we can catch, and also really look at where the coverage is geographically and also for different languages. So we weren't like maybe having two in one area and done in another area, and also limiting those so we can, and partners that we've worked with too that have experience doing this work, looking at that as we do the grants as well. And that way we could award more to the grantees that come on board versus, you know, having three in one area and being able to work less. So we also looked at that too. And same with the agents, right? So yeah, we're doing our best with the money we're allotted. And then, like Chicky said, if some choose to go out, because some have, right, they'll be partway through and they're like, we're actually not doing that much of this work, so we are going to end our grant. And then we're like, okay, maybe we can move some of this to other community-based organizations. We've also in past years looked at grants that are offered through other resources, right? For like through the federal government, like the modernization grant that we offered. So we do look for those opportunities too, to see if we can pick up those to add to that funding. But yeah, we're doing as much as we can to make sure we can get you the resource. We completely understand. Yeah.
Matthew Woodbridge here. This may be two questions, and these may be for Caleb rather than you, Chicky. On slide 14, the historical assessment rates, the 550 and the 685, those are, if I'm understanding correctly, those are literally just the state portion. Those do not include the federal 2%. So, and then the follow-up to that is, do we have a number? Can we put a dollar number to what that federal 2% is if we looked at it as a per member per month? Just for reference, you know, going from 685 as an assessment to 3560 as an assessment is a big jump, but that jump also now has to include what would have been that 2% going to the feds. It's not going to be going to the feds anymore. So if we know what that number is, that was kind of an estimate of what that 2% was to the feds.
Yeah, your understanding is correct. It doesn't include the federal assessment, and the federal assessment has bounced around has moved up and down over the years. So I was just now looking at, you know, it's gone from just a recent history on the federal percentage. In 2023, it was 2.25, and then it went down to 1.8 in 24, 1.2 in 25, and then back up to 2 in 26. So, so that number, the amount that covers has changed, but 2% is roughly $17, but that's only spread over the marketplace enrollees and not the not everyone, or those that are effectuated enrollment. It doesn't necessarily cover everybody that is in the marketplace. So if you add the state-based assessment together with the federal assessment last year, it is a bit less than the proposed assessment rate. And fundamentally, that's because the enrollment has come down quite a bit due to the end of the enhanced premium tax credits. And so there's just fewer people to spread those costs over. And that's one of the main drivers.
Thank you, Caleb. And just as a clarifying point, it's you're calculating it against average premium, correct?
Yeah, sorry, that is at the average premium.
So it's not Matthew Woodbridge here again. So it's essentially, you know, the slide is a little bit jarring, you know, the 685 to the 3560, but I think that missing piece of the federal assessment is important when we look at this increase. It's not as big as an increase ultimately as it looks, you know, here with the data we have, because there's that federal piece in there. So thank you.
Stacey Carmichael. I'm from MODA, so my perspective is a little different. I think we need to take another look at the expenditures, because passing on this much into the Oregonian consumers as a market is significant during a time that the market's shrinking. There's a lot of volatility, and it was mentioned, you know, in the presentation with the reduction of carriers in the market. So passing on this fee, and I think from our perspective, we looked at what was the percentage of the premium currently, and it was about 2% and 0.9% was the previous, what we calculated, the state fee that we paid before. So going from 2.9 to 4.9 is a big deal when you're looking at premiums and the rising costs. So I would say from a health insurance perspective, from MODA, from one carrier, this is concerning to bring this much money onto a market that's already feeling quite a bit of pressure. So that would be our concern. I think there's only so much you can do. The math is the math. So I'm suspecting that going to a new platform, those costs aren't going to be forever. You're going to pay more in the initial year. So what can you do this year that's a little different? And it's not great because you're cutting back somewhere. And so, but I think we have to look at, you have hard costs, which would be the exchange fees that you have to do for the technology platform. Looking at the grants and the assisters, unfortunately, is probably where if you have to make cuts, that's where you would have some ability to do it. I think that's where we have to look and make some hard calls and know that they're short-term, I believe, because I think, like I said, the majority of these costs that we're experiencing are attributed to a one-time technology investment and transition.
Thank you, Stacy. And so just wanted to check, where did you get your 4.9? So from 2.9 to 4.9. I'm sure you probably also have some math from your team.
Yes, I mean, I didn't do this math.
That's okay. We just wanted to make sure that we were tracking. So we were obviously wanting to make sure, because we're tracking it as from 2.9 something to 4.3.
Okay, so we're 4.9, and I think that we used it based on the 2026 statewide average premiums. We expect that to drop a little bit in 2027 because of the decrease in enrollment. So I can happy to share that feedback along with you. Like, it came in late last night, so I was trying to like do my best to bring thoughtful feedback that represented all of us at MODA. And so I'm happy to put it in writing back.
Yes, please. We appreciate that, and definitely appreciate the feedback. And that's if I may just add on to that, that's one of the reasons why there's a beauty to the annual assessment rate process, because we get to reevaluate, like, okay, so how much savings were we able from the previous year? How much savings are we able to bring into the following year? So unfortunately, there's not a lot of savings that we can bring into 2027 because our enrollment came in so much lower this year. So like our assessment rate from when we projected 2026 marketplace assessment rate back in the spring of last year, we were only able to project maybe the EPTC expiration. And after we set the rate, oh, by the way, there was HR1 that dropped. And then the program integrity rule also dropped. So other impacts that we were able to put in our modeling suddenly came into play. So unfortunately, 2026, we're already using our savings because of federal change that we weren't able to project at that time. So all I can say is that is one of the beauties of our annual assessment rate, is we can evaluate on a monthly basis and an annual basis of like what savings can we bring on. So if you're asking us to really look into where we can cut, like, absolutely, we get that. So let's just say for 27, let's just say we were able to move forward with some form of rate. And then in 27, roughly around this time again, we're going to look at, okay, so what savings are we able to bring in? How can we lower the rate in 2028? So I hear you. We're doing our best. We're trying to figure out left and right where we can cut costs. 2026 is rough in terms of enrollment, so it's not helping us in 2027.
So, Chicky, on that note, can you share like an example, like a breakdown of all your costs in terms of what is it going to, what are the line items is that? Can you share that with us in terms of?
We'd be happy to. I do know it's already published to a certain degree because we had to submit our agency requested budget. So our budget goes through a biennial process where we submit it to our agency, and then our agency submits it to the governor, and the governor then submits it to the legislative body for their approval. So we do have that published, but if you're looking for a more recent updated version, we'd be happy to publish.
That'd be great. I mean, help us better be more informed in terms of helping you.
We can do that for sure. So there is a summarized version in the memo for the assessment meeting. So there's a few there, but if you really want all the details, we'd be happy to share as many.
I mean, that's what I want to, but to help you better, I guess. Be more better.
We also have the annual report for last year, which I know it's not going to reflect everything for the SPM, but
yeah, I just wanted to share too, Mr. Rice, sorry. Stacy, thank you for all what you were sharing. I just want to say with the community partners and the HA grants, like, I get that, but it's also a double-edged sword, right?
Yeah.
So if we don't have partners out there supporting enrollment, outreach, applications, then we lose enrollments. And also right now, just over the last year specifically, we've seen a lot of individuals who don't feel safe going to get support, and our community partners and our agents are where they feel safe. And they're hosting events within their communities that they do attend and get that information. So it's hard because if we cut back on that, then we lose enrollments potentially. So,
and you lose money.
Yeah.
I think it's a double-edged sword. It's not an easy decision.
No,
it's not. The math. But also, like, this is a significant cost burden to the market in a very unusual, volatile, crazy time. It's a weird year.
Thank you, Stacy, for That should be the tagline, maybe of 2020. Year. I think somebody has, is that Yes.
Oh, yes, hi. Sakina Virtual. Question to Caleb, on the slides and expenditure that you forecast 39 million. Do you have number for 2028 or 2000, for the following year too? That's my questions, number one. Number two is, just going along with the current slide on the ORS 741.105 to have enough money to pay for the grant. I want to know among of these 39 million or so, what percentage of this portion to be for the grant to provide to navigators and agents?
Yeah, I'll defer to Misty maybe or somebody to talk about their budget estimates for 2028. I don't think that those are released yet, but I'll defer.
So actually, Caleb, I'll take that on. This is Chicky Flowers, again, Marketplace Director. So unfortunately, we don't have that yet. We have to go through, the agency requested budget process, and that will go through again to the governor and to the legislature. And that's a process that we go through every odd year. So we don't have those numbers yet because we have to go through the approval process. So unfortunately, at this time, July of 2026, we do not have the expense, the final expense reports, or at least expense projections for 28 and 29.
Okay.
But I would imagine, so just in terms of timeline for your awareness, the governor's approved budget usually gets released in December of this year, and then it goes to the legislature, I think, as early as January of 2027. So once we have those pieces of information, we'd be happy to share it with you in the HIMAC.
Okay. So the second, go ahead. Yeah.
Missed the second question. I'm so sorry.
The second question is, you forecast 39 million, and we're talking about this grant to give to navigators and assister and whoever. What percentage of this, of 39? 1%, 10%, 25%?
Thank you for your question. So we are scrambling because we don't have the exact percentage number. So if maybe we can come back in a couple of minutes as Liz and Misty. I just shipped them together. I just combined their name. I'm so sorry. As they look through the numbers to give you a percentage number, and we'll get back to you here in a couple of minutes.
Thank you.
Any other feedback before we dive into rulemaking? Then we'll go back into Holmes' question.
Matthew Woodbridge here in the room. I think to Stacy's point, the math is the math. We have a relatively difficult year and decision and a heavy lift ahead of us. We've been working on the transition to the state-based marketplace really ever since Cover Oregon stopped. Ever since we went to the hybrid model, it has been a stated goal of the state of Oregon to move back to a state-based marketplace. And things aligned for that to happen. And a lot of effort went into that planning, a lot of work from a lot of people across the state. And there's a lot of excitement about that. It's just a quirk of fate that the timing of that transition is what it is in relation to changes at the broader federal level and in the economic things that are happening right now. Which puts a lot of stress on everyone from a budgeting and financial standpoint. As Misty mentioned, the navigators and assisters and agents and those partner organizations out in the communities throughout the state, really in the transition year to the state-based marketplace, in my mind, are even more essential than they've ever been, because boots on the ground is how we're going to ensure that as many Oregonians as possible maintain coverage and stay covered through 2027 with that transition. So the math is what it is. I think the assessment, based on what I've seen in our previous discussion, this discussion, looks like what has to happen. And then, we'll do as well as we can, keeping people covered and minimizing that drop off in future years, and hopefully be able to see that assessment come back down. I mean, we won't have the huge expenditures of the state-based marketplace going into effect in that first year. It's going to be less expensive in future years. It's kind of, it is what it is at this point in my mind. And our task is to work as we can through our strategies and planning in the future to bring that back down and relieve that burden as we go. So looking forward, I think we can resolve this with a one-time pain.
Thank you, Matt. Okay, so I think, thank you, Matt. So I think our math, I'm beside our math gurus, and they are doing their best to really get your answer home as quickly as possible. So in the meantime, if we can move on to the rulemaking, even the more formal piece. The more formal piece of this whole process. So Victor?
Thanks, Chicky. This is Victor Garcia again, opening the rulemaking advisory portion of the meeting. Next slide, please. So when we change this, the assessment rate, that is done by administrative rule. You heard a lot of context just previously, and heard mention of the statute, our statute 741.105, that requires us to establish the assessment rates for QHPs and standalone dental plans through the health insurance marketplace that are sold through the marketplace. So again, that's the funding for basically everything that we do, including platform and grants, et cetera. The rates are reviewed annually, and they're adjusted based on assessments, projections in the year prior. So right now we're talking about 2027 rates that will be effective January 1st, 2027. We're required to consult the HIMAC and other interested parties to just get feedback on what our proposals are. They can review some of the information, including our expenditures. And the scope of our rulemaking is limited to just that amount, the amount of the assessment. So it really doesn't change anything else about our rules or how they work other than just the amount that's going into the assessment. With that context, when we address interested parties, ordinarily, the only parties directly paying the assessment are insurance carriers. So it's a rule directly affecting insurance carriers. But obviously that's done by way of insurance premiums from Oregonians who are buying the plans. So we try to include all of that information contextually in our rule filings as we address the fiscal and economic impact. Next slide, please. So what we would like as part of this rule advisory portion is just to get feedback on primarily this part, the fiscal and economic impact. There's two main sections that the rule making process addresses. So one is any state agencies, units of local government, or members of the public that are likely to be affected by the rule. As mentioned, we've previously included information regarding potential impacts to consumer premiums and what's being paid by carriers. But wanted to see if there was any additional information you think we might want to add as we make this in the rule filing. Once this is done, there'll be a notice that goes out to the public and to legislators to invite comments, so public comment and any questions from the legislators. So anything that would go into this filing would also go out in those notices to prompt feedback. So aside from impact to carriers directly and to Oregonians paying premiums, is there anything else we should consider when we're talking about economic impact to parties in the group? That's just a general question for the
committee. Yes. I don't know if you can measure this, but in terms of the level of care, indirectly it has an impact in terms of the cost to providers, of course, in terms of the willingness to be part of this type of program. Does that make sense? Will that impact the willingness to be part of this if the costs are not going to?
Sure, you mean like a insurance companies?
Or providers, for example, or providers, I guess, in terms of insurance companies. So for example, we're also looking at, for example, at the HOP program, how that impact providers in terms of Medicaid cuts. So some providers are saying, you know what, we want to be part of this anymore. Just, it's not effective for my business. The provider can have an impact. So I don't know, is there analysis in terms of the indirect impact on providers, I guess, in terms of the willingness to be part of these type of programs? Because I guess I'm assuming as a provider, I can choose or not choose to be part of this program or not. I mean, I don't know how it works. I'm not an expert, but.
No, definitely. So that is a kind of a defining line between what the marketplace does and what a program like OHP or OHP Bridge does, is that we don't have like a direct line to providers, but it is indirect. So the indirect impacts that they might see would be, potentially if there's, if policies are too expensive, and people can't afford any kind of insurance, it would be less people coming in with insurance. But otherwise, what providers would see from their perspective is people with individual marketplace coverage and individual qualified health plans that are insurance, the regular insurance. So the assessment itself, I don't know that they would see a direct impact unless we think that's going to have some kind of like downward push on the number of people generally that have insurance. I don't know that that's what we're seeing here necessarily, and also that the number of people with marketplace coverage versus the totality of people with like insurance and Medicaid coverage isn't that huge for Oregon. So it's, between 100 and 130,000, 140,000, depending on the year, compared to like upwards of 1.5 million at this point on Medicare or OHP programs. So I don't know that they would, and we don't have analysis. So this is me kind of off the top of my head, but that's generally our relationship with the providers. We've tried to engage just to give an opportunity to say have some documents or pamphlets or outreach materials maybe in their offices where they could say, if you don't have coverage and you've never applied for coverage, here's a way for you to apply for coverage, or if you've been denied OHP, here's another possibility for you. But aside from that, it would be difficult to draw a direct line to something that they would see that would be significant. But that's also part of like the public comment period. So if we're wrong about that, or we're not seeing something, definitely we invite that, but it's not something we've heard of or seen in any of our
because I would assume you all did your homework to really come up with this number, and assuming you went through analysis in terms of this, rate.
That's correct, and that's been over a number of years. So we are where we are right now. After having started the SBM project and the platform, cost that we're now considering as part of our assessment, having started the project with, we're going to save money over healthcare.gov, it'll actually be less.
Correct.
And over the years, having that needle move as and really trying to predict every year what's going to come the following year, presented a series of risks that could increase or decrease enrollment, increase or decrease premium costs, and maybe not assuming that all of our risks have the worst possible outcome, which is kind of what 2025 was like. So that was a really kind of, not knowing how much of a hatchet the federal government was really going to take to really consumer affordability when it comes to this space. So that puts us where we are right now. So certainly we do that, but that also we do as much homework as we can. Doesn't mean we can't be surprised by something or hear something we haven't heard before. So if we did have providers say, hey, actually, it is affecting my practice in this way, that gives us a sort of way to say, oh, okay, we haven't, this is not something that's come up in our numbers or anything else before, and then we could pursue that. But so far, we haven't heard anything like that. Thank you.
Victor, if I may.
Yes.
Okay. So I just want to add that whenever the costs go up like this, what tends to happen, what we worry about is the risk of this market, because those that are willing to increase premiums, right? Because the costs are expensive and you're looking at the same price as a car payment, a mortgage for some people, their rent. And so the ones that are really choosing to purchase this are the ones that really need it. They're sick. That starts to lead pressure into the health of the market and then the overall stability of prices going forward. That's what we worry about. And that's why prices are so concerning. When we talk about the providers, no, there's not a direct impact to the provider, but what it does do is it puts additional pressure on health insurance companies to get aggressive on those contracts and making sure that we're getting the lowest, the most aggressive price to keep these prices down. And when that happens, we see, unfortunately, like it's in the news, there was a lot going on this last year with contracting and providers and insurance companies not agreeing. So that is a risk. It's not a direct risk of this, but all this puts additional market pressure and it does have that ripple effect. So that's all I would add to the commentary.
Thank you. And then, so is there anything else? Moving on to number 2 is the effect on small businesses. In the same way, we haven't previously identified any direct impact to small businesses generally, because small businesses are not insurance companies by and large. But again, there are potentially indirect impacts that we could mention, and there are more specific questions on small business. So the number of types, reporting and record keeping or administrative costs that might change for those small businesses, and cost of associated professional services and equipment, supplies, labor. So any increased costs to small businesses generally. Again, this is not a rule within its scope directly affecting small businesses that we can identify, but wanted to see if the committee had any input on that as well. Anything we might include even peripherally or indirect, just to make sure we're being as complete as possible. Okay. And next slide, please. So with that, our rule amendment proposed language every year when we do this assessment rulemaking, when we propose the rules, it adds an additional section to Oregon Administrative Rule 945-030-0030. That's our assessment rule. And so for this, it would be effective January 1st, 2027. So every year we have an effective January 1st of that year that effectively makes it the rate from that point forward until we change it again. So we would have QHP for the marketplace would be 3560 times the number of members enrolled in marketplace plans that month, and standalone dental plans at $1.70 times the number of members enrolled that month. So per member per month. As proposed language, this would be what we send out in our hearing notice that begins a public comment period. So that doesn't mean this is exactly what is going to be filed, but more that this is what we are proposing, and then inviting comment by, again, the legislature, the public, to inform what the final decision on the rule will be. So since we are still talking through some of the details of that, some people have asked for different amounts. Again, this doesn't set anything in stone, but it is what we put out in the proposal, since it is what we are estimating is needed to cover the costs. So this is the only section of rule that would change. And again, this year being a lot different than other years because of the size of the increase that's needed for a number of factors, and including offsetting what's being paid to the federal government right now for BFFM. Any questions about this part? This is pretty straightforward, but also, yes, Matt.
Matthew Woodbridge here in the room. So reading this language, the insurers are only paying the administrative fee for members enrolled in marketplace plans. They're not paying the fee for members enrolled off the exchange.
So there's a nuance there. So yes, correct. The assessment that's paid is only the number that is assessed. It's only the number of on exchange or on marketplace.
And is there something in place in Oregon that prevents insurers from charging different premiums on and off exchange for the same plan for the same enrollee?
Off the top of my head, I'm not actually sure about the premium part, but I do know that the same plans do need to be offered at Haiti.
Hi, everybody. Cutie Button. So carriers are required to charge the same rate both on and off exchange. So if they offer a plan on and off exchange, we do have some off exchange only silver plans in Oregon that have slightly lower rates because they do not have to include silver loading for folks who receive cost sharing reductions, but it's very small now. So those plans are only offered off exchange, but they have pretty similar rates.
And in addition, the nuance that I mentioned is that when carriers do rate making, they are actually required to spread that administrative cost over the entire exchange, not on and off exchange for those plans. So, so what an individual person might see, and it is kind of an aggregated administrative cost amount that kind of goes into that. So it's not like a person would see a line item that says marketplace coverage cost, but so that is spread over more people than are just enrolled through the marketplace. So again, there's a nuance there, but in terms of what we're looking at here for assessment purposes, we're only looking at people that are charged against being on marketplace. And I see there's a question. Is that on?
Yes, hi. I'm just on virtual and I could not hear very well. So can you confirm that this is going to be charged only for the people and for the member enrolled into the marketplace only?
Not exactly. So what people will see for the premiums that they pay will be determined by what's done through rate making. That includes these rates for the number of people with marketplace coverage, but that those premiums are for everybody either on or off the marketplace. So it's not only marketplace people that would see an increase, I guess related to this. It would be kind of be anybody with a QHP, but for purposes of what carriers will pay when they count the number of people, they're only counting the number of people on the marketplace to pay the assessment. So in essence, nobody's going to see more or less impacted by this because they're on or off exchange. It would be the same, or on or off marketplace, it would be the same.
Can I ask another question? When you use this number of 3560, do you have the factor of retention for the insurance companies too? Because some people might come in for 1 month or 2 months. It's, for me, it seemed to be high, 3560.
Yes, so I mean, there are a number of factors that are considered. So it's really, in the end, based on a lot of averages. So average would include like knowing that at the beginning of the year, we have a certain amount of people that enroll during open enrollment, and that number drops slowly over the course of the year, whether that's people coming in and out for a month or two, or just slowly with attrition over time, not being able to afford coverage later in the year and not wanting to. So it is based on averages, but those are projections generally that would include that kind of information.
All right, thank you.
Okay, next slide, please. So in terms of just process, the administrative rule filing process has a few different steps. So the next step in the last half of July will be us filing the notice of proposed rulemaking. And again, that's we filed that with the Secretary of State. That includes our proposed language, some additional information based on your input today, and other factors that we've researched going into the economic and fiscal impact statement. And that also goes to the legislature. That sort of starts a timer, I guess, for a minimum amount of time that has to pass before we can file the rules permanently. And that should happen here within hopefully the next week or two. Last half of August would be around when the hearing would happen. So again, that filing process of filing the notice kicks off a public comment period. People are able to submit comments at any time related to the rule. And then at the hearing that will be scheduled again the last half of August, that we also accept public testimony at that time. So that throughout that whole period and at the hearing, we'll be accepting input that could impact the final outcome. And then September, based on all of that input and feedback, after a 49-day minimum period for legislative notice, we would then file the permanent rule and send that notice out after that's done. So that's just a quick overview of the rulemaking process. Are there any questions about that? Okay. And I think that'll do it for this portion. Thank you for your feedback. I'll hand it off to Katie.
Hello, everybody. I'm Katie Button. I use she, her pronouns. I'm a plan management and policy analyst for the marketplace. I certify the plans we sell in the marketplace. Don's giving me the slowdown signal. Thank you, Don. I'm just so excited to talk to you all. I just love people so much. So I'm going to go over today some federal changes. I've talked about these before, so you will have a sense of deja vu, but these are the ones that are going to be in place for the 2027 plan. So the first is a set of immigration status changes. So this will be for folks who do not meet the definition of eligible alien. And so folks who will meet that definition are green card holders, citizens of the COFA nations, and Cuban and Haitian entrants. And so it's mostly folks who are refugees and asylees who will not meet that definition. They will still be eligible to enroll in plans, but they won't be eligible for tax credit. So they will see full price plans this year. Next slide, please. So currently, we are slated to bring income verification back into play. It is an old policy. It used to be in place. And so what it means is if someone reports income on their application that is significantly different from other sources such as the IRS, the exchange will ask them to verify that income. And that could be uploading a pay stub, a 1099, so just something to show that, like, yes, this really is my income. I didn't make a mistake. So we are currently planning to put that functionality back into place. However, the current City of Columbus lawsuit, so there was one last summer, we're calling that Columbus 1. There's one this summer, we're calling it Columbus 2. That has asked for this provision to be stayed. That case was supposed to have preliminary judgment this week, and we have not heard yet. So we are waiting to see if that will be stayed. If it is stayed, then we won't put that functionality in place. If it is not, then we will put that functionality in place. But folks should be prepared to possibly need to provide further verification of their income. Next slide, please. So we do have a few changes that are not affecting Oregon. So the first one is expanded eligibility for catastrophic plans. So new federal rules allow folks who are not eligible for either cost sharing reductions or tax credits to be eligible for catastrophic plans. We do not have catastrophic plans in Oregon, so folks can apply for the exemption, but they won't have any catastrophic plans to enroll in, so we don't recommend that because it doesn't really have any value for folks. And the other change is plans without networks. These are also called non-network plans. These are allowed under federal rules, and so kind of how these plans function is that there is no network, so consumers would provide the claims directly to their insurance carrier. Our carriers have not filed any of these plans. I think none of us are really interested in these plans. Provider networks are both a benefit for providers and consumers because it allows the carrier to be the entity that coordinates those claims, and so folks know what they're going to pay up front, and then providers get their money in a timely fashion. And that is it for me. Just a few changes to talk about. If folks have questions, I'm happy to answer them. All right, I think we're ready to move on to our next agenda item.
Hello, everyone. This is Dorosita Mardashiv. I am the Senior Project Manager for the State-Based Marketplace, and we have quite a few presenters today to walk through the project updates today. Next slide, please, Dawn. All right, lots of updates here. We're going to give you a quick implementation timeline update, some key project accomplishments, give you an update on the engagement in CMS activities, introduce the Oregon SPM technical team, marketplace training, and feedback for Get Insured. Actually, these, yep, there's a few items here actually changed, so we'll have to correct some of these. And we're going to be actually talking about the website updates. So the technical team, we're not going to discuss. So there's a few topics here that have not been updated. So apologies for that. These errors here. Let's go ahead and move on to the next slide. All right, so this is a timeline that we've been sharing with you throughout these quarterly updates with y'all. And we have quite a bit of activities that are in blue, the dark blue, that is in progress. This is a work stream of, we're focusing on the configuration platform of the call center. So we continue to work through those, working closely with Get Insured folks to get those requirements and planning activities completed. We have conducted system testing that's in progress, and we continue to, we just actually completed UAT testing for 26.6 release, and that has been successful, but we continue to work on testing activities. Implementing call center hiring and training technology, that is another activity that we continue to work on, making sure we have the appropriate folks and hired to support to be included in the call center and give them the appropriate training. One activity we did complete is we did complete the UAT testing. So we did get approval for, provide approval to deploy the release 26.6. And then we have the implementation production environments that is in progress and on track. And then we continue to conduct interested parties training. So that's in progress. And MSC will be giving a little more details about the training that is in place for some of the parties. And then the rest of these activities, we will continue to keep on our timeline. They have not been started at this point, but our soft launch of October 1st is still on track. Our full launch is on track for November 1st. Any questions? The visual of this is starting to be a little more visible here since we continue to knock off things on our timeline here and focus on what we are working on and looking ahead. Next slide, please, Don. So these are a few key project accomplishments since April. These are not all of the accomplishments, but some of the highlights. Last time we've met was mid-April. Since then, we've working closely with our one program folks and making sure our infrastructure for supporting the interaction between the one system and the SBM system are going to be ready for us to complete and be ready to be fully functional by go live. That is all on track. We've approved the infrastructure and we have completed the development of that infrastructure. And as another activity is we have our independent quality management services contractor Blue Crane, who continues to provide oversight, observe our project management practices and how the project is performing. They provide us our quarterly reports. That is being continued, and we approve that the last quarterly report on April 21st. Another service that Blue Crane is providing is reviewing some of our project deliverables, which one of those was the solution contractor system testing plan. They review that, and then from there we would take that feedback and incorporate it into our plan to make to improve that quality of the deliverable. So that was approved on April 27th. In May, we continued to work with Get Insured. We approved their defect management plan. Blue Crane is IQMS. They reviewed our solution requirements, our requirements traceability matrix, and we approved that deliverable. Another activity was the working closely with our independent contractor to complete security and privacy assessment activities, and they produced a report. That was a two-phase approach. The interim was the first draft. We reviewed it, approved it, and then we approved the other version in June, the final version. We continue to work with Blue Crane and provided feedback on the independent master test plan for the FDSH testing verifications. That's been approved. And then also the one and SBM SIS. So this is the after our infrastructure development, we also actually approved the testing for the system between the one and the SBM system. June, we went ahead and approved BPM's final security and privacy assessment report that was submitted over to CMS for approval. That was accomplished on June 2nd. We also approved their security and privacy assessor workbook, another document required by CMS. And then we also accepted the plan of action milestone document we've accepted that and submitted that over to CMS. So all of those artifacts are part of the HC packet and much more. We have our system security plan and other technical documents that are required for the final authority to connect packet, and that was submitted officially on June 2nd. So lots of documentation required by CMS that we did actually meet our target of getting that submitted over to CMS for review and approval. And then as we continue, we have another development as we were learning about the requirements for SBM and the one system to interact with each other. We did open up a new change request, and that was approved. And on June 5th, we completed the development of the enhancement in this change request, and then so that has moved forward. June 5th, we finalized the agency test plan. And this is the test plan for completing our our user acceptance testing that we have accomplished in June. And June 10th, we approved the Blue Crane's disaster recovery plan. So they did review our disaster recovery plan and to ensure so that was approved. And June 16th, we accepted all plan and policy procedure documents from Get Insured. And lastly, June 29th, we approved, Get Insured has drafted the system security plan. We approved it, the state has approved it, and then that has been sent over to CMS for review and approval. So quite a bit of activities happening here, but and a lot more accomplishments that are happening, but these are the ones we wanted to share with you today. Any questions? All right, next slide, please. All right, so this one here is the engagement we have with our Centers for Medicare and Medicaid Services folks, and some of these activities actually out of date. We're kind of running quickly on these, trying to get these documents finalized. We have our Intergovernmental Cooperation Act agreement that actually is complete now and executed. We just have one more last internal step that needs to be completed. And we just need to upload that agreement to our Oregon PI system, but this is not a showstopper. There's no impact on our CMS or the go live. The ISA, the Interconnection Security Agreement, this agreement 2 days ago has been officially signed, and CMS has issued the authority to connect to their system. So that's a huge milestone. So hot off the press, that was a huge milestone we just met 2 days ago. The system security plan, again, this is a little bit out of date, but we did actually already provide feedback. We responded to CMS's feedback. We've sent the information back on July 9th, and now we're pending their feedback, hoping this will be the last round before we could get that approval. But things are moving pretty quickly on this one as well. The privacy impact assessment, this one, we also have already responded back since we've updated the slide. Last, we actually responded back on July 2nd, and we're waiting feedback from CMS on this one as well. The Safeguard Security Report, this is a report that is actually sent to IRS, and working close with IRS to get their approval. They actually just sent their feedback yesterday, so we are working internally to address their comments and send them an updated version. But these review cycles from the state perspective, we're trying to turn them around as quickly as we can to get them across the finish line. And the pay record information template, that is completed as of June 29th. We have CMS confirmed that there is no action for the state to take at this point of time. Any questions on this? And this is just a glance of some of them. We have a lot, some of the activities that are happening. We have other more activities that are happening with CMS, but just wanted to highlight these areas. Any questions for me? All right, next slide. And I think I'm going to pass that on to Amy.
Yes, thank you. Amy Coben here, Communications and Public Engagement Analyst. And I am excited to share with you a little bit about the communication side of things. So switching gears just a little bit. The first thing, just wanted to share an update on the brand development and kind of where we are with our Explore Health brand, which we're very excited to get out into the world, hopefully sooner rather than later. Of course, we do, before we're able to start publicizing Explore Health, we do want to wait and need to wait for our approval from CMS that we're allowed to go live, which we're hoping will happen a little bit less than a month from now, which I can't believe I'm actually saying. But once we get that green light from Explore Health, we will start to switch into a brand awareness campaign with the primary intent to build recognition of Explore Health so that folks understand its connection to our existing brand of OregonHealthcare.gov, because as a reminder, OregonHealthcare.gov will not be going away. We will still continue to maintain that website. It is being updated to be more of a hub for health coverage information, so folks can go there to get information about all of the different types of health coverage available in Oregon, which you'll see kind of on the left side of the screen here. And then depending on what type of health coverage you need, we'll send you off to the right program. And of course, Explore Health will be one of those options. And of course, during the brand awareness campaign, we are hoping that we will build confidence and trust with the people of Oregon so that when open enrollment rolls around, folks feel confident and comfortable coming to the new system and enrolling with the new brand. Next slide, please, Dawn. So I'm excited to share with you all kind of a draft view of our homepage, landing page, whatever you want to call it, for our website. This is kind of how I'm envisioning our homepage looking. You'll notice that it's very simple, graphic, easy to understand, hopefully, clear messaging. We are using graphics as often as possible to help folks with limited English proficiency, making sure that our imagery is representative of the people in Oregon. By the way, I just want to say we recently wrapped our photo and video shoot, and we got our results back, and they're amazing. The folks that we were able to use our models, if you will, were actually real families and people in Oregon, and they open their homes to us. So it's actual real people in their real homes. So it's very, very representative of the people that we're serving. So very excited to integrate those photos into our website and all of our materials. But this just gives you an idea. The upper part of the page will really focus on the top 4 things that we want folks to do, which is preview the plans, claim their account, find local help, and apply for coverage. And then the next section will help folks if they are kind of not really sure what they need to do, but need a little bit more information. So that'll guide more towards the informational sections of our website. And then the last section of our homepage will focus on how to get help. So we'll have information about how to contact us directly. We will have information about how to chat with us, and then we will have another place there of how to reach our Find Local Help tool. So we do want to make sure that we have a couple of different ways to get to that tool. Next slide. So this is our planned site map. And I know this feels a little overwhelming, so I apologize, but we have a lot of things we want to share with the folks on our website. So basically what I did was I went through our policy manual and I took all of the different topics that we cover in our policy manual, broke it down by topic, and I thought about the user experience and at what point in the user experience folks might need to gather this information. And so the first step folks might run into is exploring their health coverage options and shopping for health coverage. Once they are done exploring and shopping, they're going to be, of course, wanting to use and maintain their coverage. And then, of course, they'll have their renewing step as well. So then we'll have these different categories, and then we'll break down the information by each category so that hopefully it'll be a little bit easier to navigate and kind of find information. What I did from that point was I took the information from our policy manual, and thanks to the lovely Katie Button, who did a lot of assistance, and then some other folks on our team worked really hard to put all of that information into very easy to understand, plain language, used as many bullets as possible so that there's not a lot of paragraphs and things, made it as skimmable as possible. And then I haven't actually started building these pages out, but as I'm building them out, I'm going to use iconography and graphics as much as I can to really represent this different information. So this is kind of the structure, and let me look at it. So I did want to get a little bit of feedback on the 2 pages that I showed so far. I'm just hoping that if any of you HIMAC members have any feedback on kind of the proposed homepage or the sitemap, would love to hear. Yeah.
I like it. Yeah. I like it, that the simplicity of it. It looks really easy to navigate, which is always great for me when I have a hard time. So thank you. Yeah, that's good.
Can we go back to the previous slide? That had kind of the homepage shot, just so people can see that.
Mm-hmm.
Elena has a question.
Oh, Elena has it. Oh, go ahead, Elena.
Oh, I just wanted to say that it looks great. As I think someone told me, as someone said, that it looks simple. It looked great. I love it. My only question is if there's going to be like a little tutorial for the consumers how to use the website. Like, you know, when you open a new website and then you have this open, and then like another window kind of opens and says, oh, this is how to use the website. Do you accept the little tutorial or not, you know? Like
That's a great idea. Yeah, no, that's a great idea. I will definitely make note of that. We did recently get some software that may help us make something like that. So I can definitely look into making something like that. Thank you for the feedback.
Cool. Yeah, otherwise it looks amazing and I love the branding. I don't know if you're gonna make t-shirts with Explore Health, because I love the Mount Hood and I was like, I would definitely wear this t-shirt.
You are not the first person to ask that. We actually had someone, a staff member, ask if we're going to open a swag store. So
Yeah, we need a merch store.
Yeah, we're
I think
not the first person to ask. We're exploring our options for how we can share our logo and see how we can do something for folks we trust.
Amy, I think it looks great. I'm assuming you're going to have it in Spanish also. I don't know.
Yes, yeah, we do currently have, of course, our Quiero de Salud .org.gov. So we'll have that still, that website in Spanish natively. And then, of course, we will, our website inherently has the Google Translate, which I know is not the best, but it at least will provide translation for a myriad of different languages too.
Thank you.
All right. Well, then I will move on to the next slide. So a couple of other things that I just wanted to talk about with the website design. I really intentionally, as I mentioned before, trying to be very intentional with the design to make sure that the pages are very organized with a clear and very consistent layout so that people understand if you're going from one topic to another. They don't have to like try and figure out where to go and what to do. They'll have the same general flow and structure. So it'll be easy to navigate. Again, easy to read text with strong color contrast, so we don't have to worry about, you know, light gray text on a lighter gray background or something like that. When we have any forms or labels and things, make sure that everything is really clear and consistent and easy to understand. We worked really hard on the content development for the user interface for the platform itself, to make sure that all of the help text and all of the different field, I'm losing the field text, whatever that's called, the labels are very easy to understand so that folks really understand what what we're asking of them. And so we worked really hard on that, and actually over the last couple of days we did some testing with our partners, and Matthew was there, so he kind of got a preview, but we did get some really great feedback on that verbiage. So I think we're moving in the right direction. And then making sure that we're not communicating anything purely by color. That's something that some companies are guilty of. We're going to try to avoid that because as you may know, some people are colorblind. So if you communicate purely by color, then that may not be impactful for all individuals. And then making sure that buttons and links are large enough to actually tap and click so that you don't have to actually zoom in on the page or anything like that. Next screen, please. And then speaking of accessibility, we do want to ensure, so that the screenshot that you see here is actually like a tablet view, if someone were to use it on a tablet or even on a mobile version. So the website will be dynamic, so it will work if you are on a different size screen. It will adapt. We'll make sure that all of our images that we include have alt text. So what that is descriptive text, so that if someone is using a screen reader, they will be able to experience the website fully. The links will also have alt text, which clearly describe where they go, so that again, if someone is using a screen reader, that they will be able to fully experience the website and navigate the website in a meaningful way. It will be, so the website will intentionally be designed to work with screen readers and any other assistive technology. Sorry, I can't talk today. And we'll make sure to work with, you know, any sort of device, a keyboard, mouse, touchscreen, all of the things. So we are going to make sure the Department of Health and Human Services on a federal level does have some mandates as far as like we need to meet some pretty strict accessibility standards. We would meet those anyway, but we will make sure that from launch that we are meeting all of those standards so that we don't need to go back and fix anything, basically. Next slide, please. And just wanted to show you, you have a question? Sorry.
Yeah, can you go back to the previous slide, please?
Yes.
On the first one, preview plans and saving using the coverage compass. Is this quoting, right? It's like people can do window shopping, can just run a quote from here?
Yes, and it's not actually going to be called the coverage compass. So sorry, I didn't update that. But we're calling it the plan guide. But yes, that will basically take folks to the window shopping tool.
So, and on the last one, apply and shop for coverage is mean for pick a plan, correct? Apply and pick a plan for coverage?
Yeah, so that will take someone directly to the application.
I see. I see. I would use apply and pick a plan and pick plan for coverage.
I can finesse the text there. Yeah, thank you.
Okay.
And Elena?
Hi, this is Lena. I don't think the wording claim your account makes sense, but at least it's for me. By that, do you mean like log in and sign up?
So the claim your account, we won't keep on, it won't be on there permanently. It's mostly a year one thing. It'll be for folks that are moving from healthcare.gov to the marketplace where we have set up their account for them, and they'll need to like basically enter a code or something to claim their account.
Oh, I see. It's just a little bit confusing for me because I would assume if I'm going to shop for a plan, I would look for words like login or sign up,
Okay. Yeah, I can finesse that wording. I think the claim your account wording we use in our notice text, we specifically say like click the claim your account button or claim your account. But I think that to Alm's point, we could fix the apply and shop for coverage button so it's a little bit more clear that that's where you go to log in to apply and
That
shop.
makes sense. That
Yeah.
makes sense. Yeah, thanks. So it's not like your account from healthcare.gov would go automatically to the Explore Health. You would have to claim it and kind of create a new one. And would the people have to input their information again, or it will already be saved and transferred from the healthcare.gov to the Explore Health?
No, we are migrating the data over from healthcare.gov. I can hand it over to Claire from Get Insured. She can give more information.
Hi, everyone. Yep, just turn my camera on so that folks in the virtual room can see me too. So we are migrating all consumers that currently have active accounts on healthcare.gov to the Explore Health system. So all they will need to do is click this link with the specific instructions that we provide them in order to log in. When they go ahead and log in, everything will be set up for them since we have that information coming over. As Amy said, this is a big first year activity to make it as easy as possible for our consumers to be able to access the new system who are already marketplace users. So completely agree with Amy. We'll work to phase this one out essentially. Any new folks coming to the marketplace, so have not been on healthcare.gov, would work to click apply and shop for coverage. So I know there was feedback on that wording. We can certainly work alongside Amy to make that cleaner. But that's a little bit more context around the data migration or the work to get consumer accounts into the system from healthcare.gov for this first year.
I love it. Thanks.
So Claire and Amy, this is Chicky. Sorry, not that you don't know me, but for those in the virtual room, this is Chicky speaking. So noted on the claim your account verbiage. Let's just say worst case scenario, we can't make a whole lot of changes in terms of verbiage. Is there an option to have like a help text? You know how some websites have like a little question mark that people can click into? So maybe, is that an option for us? And I think it was Elena who mentioned maybe having some form of tutorial. Maybe you can have also that option as.
Yeah, I can definitely, I don't know if that particular widget will let me do help text, but I can look into that. I also think that we might be able to like switch them so it's a little bit more clear. And then if I change that last option to something like log in to apply and enroll or something like that, that might be a little more clear of what that is. So yeah, I think there's a few different options for what we can do.
Great, thank you.
Yeah, for sure. Thank you for all the great feedback. Oh. Okay, so just wanted to share with you all, this is my last slide, is a preview of what our local help finder will look like when you go to this tool. This is where our users will go to find local help. When users come here, they will have the opportunity to select whether they want to search for an insurance agent or an assister. And this page you can kind of see it here. I know it's a little bit small, but it does describe the difference between an insurance agent and an assister, providing information that an insurance agent, of course, can provide advice on which plan is best for you, is kind of the distinguishing factor, of course. So for now, at least, they are two different searches, so they will click on one or the other. And we do have text being integrated into the search so that if someone does choose to search for an assister, for example, and maybe there's no options or very few options that come up, that it will say, you know, you can search for an agent and it'll give a link to click over to the other tool. So We are trying to make it as easy as possible to go between the two options to get the help that folks need. Oh, and one other thing I wanted to say, I'm sorry, I forgot to say this. This particular feature is built into the Get Insured system, so it's directly linked to all of the assister and insurance agent portal system listings. I can't think of the right word. I'm sorry. I'm having a problem with words today. So as our partners update their information, they will be able to manage their contact information, their hours of operation. If they reach capacity, for example, for appointments, they can take themselves off of the tool, etc. So in the past, or currently, we here at the marketplace have been the ones to manage that. Which has been working okay, but you know, it's work. But this is going to be a great option for our partners to keep it more up to date and to be a little bit more fluid. And so we're very excited for that feature as well. And we have a couple of questions. Charlie, your hand's up first.
Hi, yeah, thanks for the presentation. I guess I'm looking at this page and I'm thinking if I was searching for health insurance, I'm not entirely sure which one I would choose. Like they seem kind of like pretty similar options. And if I not knowing too much, if I didn't know much about what these things were, I would feel a little bit like how to decide who to talk to or who to talk to first. So I'm wondering if we could provide some guidance, like you're not quite sure what you're looking for quite yet, so talk to the sister, you're ready to buy, and you just want to kind of have a little bit more detail about the plans that are available and like the specifics about that, then you should talk to the insurance agent or something like that to just give people a little bit of more guidance on who they should talk to first or what the scenarios are where they would choose one over the other.
Yeah, we can definitely work on that text. Thank you, Charlie.
So Amy, follow up with Charlie. I think it's probably be easier that if you identify products like a sister can do OHP, Oregon Health Plan, Oregon Health Plan Bridge, and provide information on marketplace. When on the insurance agent, you can put marketplace plans and or OHP, something like that. So it's more like from the insurance agent, more like a full services. Because and then the assister is just helping you to get application only. By adding the product names into it might be clearer. That's just my point of view. Thank you.
Thank you. Thank you for bringing that up. One thing that I didn't mention is the difference between this tool and our current Find Help tool is that our current Find Help tool does give the opportunity to search for the different type of assistance that you need in terms of OHP versus marketplace. We even offer Medicare, Shiva, and small business opportunities for search. This particular tool is specific for marketplace because it does specifically allow you to assign the partner to your account. So for that reason, we don't have the verbiage in here for that specific type of service. When you go into each individual listing, it will list if there's additional services that they provide. So for example, if you go into the assisters, they can list that they provide OHP assistance, and then the same for insurance agents as well. I do think that, to Charlie's point, and I think a little bit of what you're alluding to as well, is that we can work on finessing the language a little bit to be a little bit more clear on what the difference is between these two groups and how they can help a little bit differently, so that folks know, when it might be appropriate to go to an assister versus an agent. So I think that's great feedback.
Matthew here in the room, and just to clarify, this search tool is part of the Explore Health website. It is not a separate standalone like on OregonHealthcare.gov. When you go, that's going to our existing search tool. When you're in Explore Health, you're working in the state marketplace platform. You're getting this search tool. So there's two different tools as well.
Yes. Yeah, absolutely. And the current tool that we have now on our Find Help website is actually going away. It will be replaced for the OHP side. They're currently working on what the replacement option will look like there. And I know our Shiba friends are working with them to kind of figure out their piece. But yes, we will basically have two different tools, one for Marketplace and one for OHP.
Yeah, I was just going to add too, I know this is one of the topics that we've talked extensively with the OHIM team on, which has been fantastic. Like this was like top priority. And we certainly, even internally, took things back, and our product VP, so the equivalent to Jason on the product side, was like, oh my gosh, why didn't we think about these things? I think the one thing I'll call out too for 2027 that has come up from other conversations is the ability, similar to healthcare.gov now, to combine the search, to make it a unified search so that folks would get agents and assisters in their area who would be able to assist. We'd also be looking to prioritize for 2027, as I know we talked about yesterday during our usability work group with a couple of you there, the ability to make sure, as Amy said, the product expertise. So if you're able to offer Marketplace or OHP, Medicare, SHOP, is listed for both agents, which will be the case for this year's open enrollment, but also for assisters as well, to get a little bit more at Ohm's point to make sure that folks have the ability to understand what support can be provided if they have also multiple folks in their household who may need some different support across the board. But we can certainly work with Amy initially to make sure that that language is updated so that before folks even start to search, they have an idea of, should we be looking at agents first to see who's in my area, or is an assister the better choice just based on my needs? Yeah.
And with that, I'm going to hand it over to Victor.
Thank you, Amy. This is Victor Garcia again in the room. Just going to talk about a few of the things we'll be doing in the run-up to November 1st. So it is happening. So first off with the carriers, as we prepare after CMS approval in August, which we're going to just take as an assumption it is happening. We plan the plan for submission and certification activities for carrier plans will move to the Marketplace system instead of to healthcare.gov. This is all led by Katie Button in the Marketplace. So the plan certification cycle where the plans are certified for sale in the Marketplace should be done by October 1st with final plan data review for the plan guide by October 15th. So that's all the plan information in the new system and ready to go, should be finalized by the middle of October. With renewal notices sent to people that have renewals coming sometime in late September or early October. And then a final system test to ensure our readiness for automatic re-enrollment. So those people that are already enrolled in plans on healthcare.gov that come over with their data migrated, that have opted into or selected to have their plans renewed, can have that ready to go for our launch. And then processing those re-enrollment files last week of October, so basically right before open enrollment, and that is redetermining eligibility for those people so that they can be renewed into the plans that they already have at that time. So that's just kind of again a brief overview of things happening in October, rolling up to November 1st. Next slide, please. And then we have the soft launch of our Explore Health website that will be associated with it, and some of the platform features that will be available at that time. So around October 1st, we will see the initial notice of the transition to people that are currently enrolled in the FFM from CMS. We do have to wait for this to happen before we can really do anything. And that is kind of a CMS consumer protection. I'll just take a moment to say, we're going to mention this, and we have mentioned this a lot already. There are certain steps we have to wait to take until CMS gives us the green light. And that is all basically making sure that we are truly ready and that they have assessed that we are ready to launch this website. So that's what that holdup is. But generally, we also have talked about a lot of the struggles we've had with federal regulation changes and a lot of the rules that made things more difficult to people. When it comes to this transition, partners we have been working with at CMS have been great. They've been responsive. They've been cordial. They've been easy to talk through any issues we have or things that we don't necessarily agree with. So the actual people we're dealing with and the partners that we're working with to make this happen at CMS have been fantastic. This has been kind of a relatively seamless process with them. So just don't want to get those two things conflated. Federal changes at the executive and federal legislative level are not great, but our partners at CMS have been great. So with that said, after that notice goes out from CMS, we'll be sending our own, like right on the heels of that. As soon as that happens, we'll get the green light to send our own account migration notices to those same folks, letting people know that their account is available to activate, and they can come in and start claiming those accounts, as you've seen on the previous slides with Amy. And then around October 15th, we'll see window shopping opening with a plan guide around that same time. And that's so people can start getting a feel for what things will cost, even if they're not able to enroll until November 1st. So it'll be good chance to preview. So that's the soft launch for the consumer-facing website. And we have a few more slides on that. So I'll stop there in case there are any questions before I get more. Okay, next slide, please. So what's in a soft launch? We are working with Get Insured, which I think is now transitioning to Vimo. So we may start just saying Vimo instead of Get Insured. Same company, so if we go back and forth, that's what that is. There will be a team in place ready to answer phone calls. Again, won't be able to offer the full suite of services that we will starting on November 1st because people won't actually be able to enroll until then, but we will have some staff available to answer questions, navigating the website, login issues, claiming account, that sort of thing, and some general questions. We have some operating hours that are going to be a little more limited than they will be through open enrollment. We'll have some extended hours through open enrollment. And a smaller team size generally for those general inquiries that are coming in, and then there'll be an expanded team starting November 1st. The telephone and consumer relations management software integration will be active, so that means that the people answering the phones will have the tools, software tools available to help identify people, and that will be ready to go at that time. And we are going through now, kind of finalizing, and by that time we'll have our established escalation paths. So if people have issues that they need to raise kind of to a higher level, people answering the phones will already know what to do at that point. And then we'll have our quality assurance measures already in place also. So we'll, as a state staff, have access to live call monitoring, weekly kind of metrics, and being able to sort of tweak scripts at that time if that's needed, so that people, we need to change kind of the guidelines people are using to say what they're saying to consumers. We can keep making those adjustments as we go. And then for our general goals for the soft launch are to validate the workflows that we're putting in place now, identify any pain points that may arise in the meantime, and then establish sort of beginnings of a baseline for the performance that we'd expect going into open enrollment. And again, those are all dynamic, so they'll continue to change if they need to. But having that month ahead of November 1st will give us that opportunity to really get things as dialed in as possible before we start seeing people able to enroll on November 1st. So any questions on that generally? Again, the soft launch is, when we can do it is limited by when those notices go out from CMS. So as much as we'd like to make it available before then, we do have to wait for that. Stacy, did you have something? Okay. And then for agents, the soft launch, we already have the marketplace training certification progress well underway. So we'll have options available in person, online, and on demand. So we're pre-recorded that be able to walk through, and we'll need to wait for an in-person time for those trainings. And making sure that everyone completes that training by October 30th to be ready and certified for enrollments by November 1st. We're working to complete process transition and to transition the enrollments from the data migration we're getting from healthcare.gov, using the NPMs we're getting associated with those to make sure that agents are still attached to the plans they're attached to right now in the FFM. And then that we also kind of separately, but in parallel, have the agent and agency information already loaded into the Explore Health system. So making sure we get that communication sent out to agents and agencies to make sure we, again, have that ahead of time. And of course, as we go, can keep adding that information to the system. And agents will have direct access to update their listing in the Find Local assistance tool during that time too. So if what information is displayed in our local help tool needs changing, agents and agencies will have the ability to change that on their own. And with anybody running into any issues, just able to communicate that to us, and we can escalate if we need to. But we're trying to make as much of this self-service as possible where it makes sense to save time. And then Misty will be talking a little bit more about training.
Thanks, Victor. So marketplace training is already underway, so exciting. So we had our partner summit last week on the 7th. We'll have a follow-up summit virtually on the 23rd. For those that want to join that, they can join it as a second time attendee, or if they missed the first partner summit. At the partner summit, we just introduced updates on what upcoming trainings, tips, resources, opportunities. We did a lot of networking. We felt it was very successful. The feedback we've got has been extremely positive, so we're excited about that. The other thing that's not listed here is, which was talked about a little bit already, was this week we also did some partner UAT testing, which also informs our training and also informs potentially some changes we could make to the platform and things if it's a doable, right? But that also it helps us inform how we train out in the field. So our first in-person training was actually yesterday, and it was in Yamhill County for our community partners. We'll continue doing, and then our first agent training is next week in Salem. And then we'll start the webinar sessions in August for the community partners. I think we might even have some webinar sessions maybe in July for the agents, but for sure in August. And then we'll do our on-demand for agents will be offered in August, and then September our on-demand for assisters will be offered. We are doing very similar as last year. We have lots of in-person trainings. We also will offer webinars in English and Spanish, and in-person English and Spanish too also. And then on-demand will be in English and Spanish. The right-hand corner there is where it looks like on our website with the link. So you can already go in there and register and pick a training that works for you as an agent or a community partner. That was a lot of fast talking, but I know we're a little behind schedule. Any questions on that? Okay. So, nope, you're good. All right. So right now we have about 45 sister trainings in person set up. 4 of those are in Spanish, and then we have 5 in-person agent certifications training set up around the state. We, of course, if we get additional ask requests for in-person trainings, we are more than happy to do that. We also at times get requests from organizations that have a large group of sisters just to do a private session, which we are also open to do that. Our training goals really are by mid-July, promote our virtual trainings in persons and for our agents and sisters, which we are there, we are doing it. And then by August, offer, like I said, that on-demand agent training. And then in September, the on-demand certification for our CPs and that community partner sisters, and that would also be in English and Spanish. So we were excited. It was a lot to get here. We had a lot of help from Venmo and others on the team. And so it's so great to be out in the field and start this training. And we'll definitely, as we're going through the training, we'll be taking feedback back to see if there's any tweaks or additional things that you all might want to hear about. Any questions? All right, I think we don't have a, sorry, go ahead,
Yeah, quickly, I will come on the July 22nd. Are you doing all the modules in the same day, or can you explain more?
Yeah, so for the in-person training, you will do the majority of the training There are a few modules that you will take afterwards, mainly what is the privacy and security one, right? Privacy, security.
And then there's a participation agreement.
Yeah, then there's a participation agreement that this will be new actually, so I'm glad you asked that. There'll be a new participation agreement. It'll almost kind of look like a quiz, and it'll say, read through all these things and you understand, check yes if you agree and it's true, you'll check that box, and then it'll move you to the quiz. You'll take the quiz, and then once you pass the quiz, you'll get the certification certificate.
And there's an optional shop.
Yes. Great question. All right, we don't have any slides for this, but I'm going to pass it over to Claire for Get Insured VMO.
Yeah, that sounds great. Yeah, I'm probably the worst and still call us Get Insured. We are moving to VMO as Victor rightly said. So same product being offered, just under our original name before we switched over to Get Insured. I know we talked last time in April, and a lot of the focus that I gave was on the collaboration we had with the OHIM team. That has not changed. What has changed is our ability to connect with external partners, and I just wanted to highlight that a little bit more. So I'll focus on CMS, I'll focus on OHP a little bit more, and then also most recently our agents and assisters. So I know a few slides ago, Doracita gave a great overview of where we're at with CMS. I think the one I just want to hit on a little bit is the authority to connect. That is an integral part, right? So this is one of the major milestones that we need to achieve in order to be able to get the right data over to set up the system. This is one of the earliest times that we've ever received that approval. So again, Chicky wins. She gets another gold star. So way to go, Oregon. It was a surprise, but it was a surprise to see it this early, not a surprise in general that we got the approval from CMS. So way to go. That's a huge thing off our plate. And then I know Doracita noted this. We recently got feedback from the IRS, and the team is actively working to get that resolved. It's just one minor wording change that we need to get right with the IRS. That should be all set. I think just building off of CMS, as Doracita also said, a lot of milestones were included. The ones highlighted were the security ones, so the ones related to the ability to connect to their hub. The other ones that are really important for CMS are a series of demonstrations to showcase that we can operate as an SBM. So CMS, every time a state is looking to transition, will put together specific scenarios that they want to see happen. We're almost through. We have one more tomorrow that will go splendidly. But the feedback that we've received is incredibly minimal, and one might argue very, very picky. So we are working right now to get things fixed in the system and provide that timeline to them in terms of when they'll be able to see it. The biggest one, just for awareness, is they'd like additional help text for the folks that are not seeking coverage but are the primary tax filers and would need to provide an SSN in order to help speed up the process for getting an eligibility determination. So I worked with Amy and Katie to make sure that that language was set. We're getting that mocked up in the system. But I think just wanted to provide just some context that they're not like, oh, you didn't get the right eligibility result. It's, can you please provide extra support for like the 2% of people that may fall into this category. And we can certainly do that, and we're working to get that done. Agree with Victor. I think the CMS team we've worked with is fantastic. They're incredibly responsive. There's one strange sticky point that we have right now with NAIC, and the whole CMS team is trying to rally to help us get in contact with folks that just are really busy. So I think it's been a really collaborative effort from the get-go, even if we started a little bit late with those collaborations just due to the climate at the time. I think moving into just the collaboration with the OHP or the one team, this will continue to be integral part. It is an integral part of the ACA right now, the ability to make sure that there is no wrong door for coverage. And we've worked incredibly hard over the past several weeks with the OHP team to make sure that we're aligned technically, but also from a policy perspective on how we're passing that information back and forth and making sure that we're getting the right eligibility results on both sides. That's the last demo we'll showcase to CMS tomorrow, and was just making sure folks were set while we were discussing. So that's looking really great. And then I think the last one I just wanted to highlight, and I know Misty teed this up a little bit, but it was regarding the usability work groups that we just had. So this was a new thing that BMO has done in this capacity, remembered the right name, and it was very, very cool to be able to get the feedback from a small group of assisters and agents over the last 2 days. So OHIM graciously found 10 folks that were willing to participate and see the system early. And so we were able to allow assisters and agents to do what they would do in the systems in real time, but just ahead of open enrollment. Per usual, we typically get the most feedback during open enrollment from our states, but it was great to be able to get that feedback ahead of time. And I know our product team is meeting today to start discussing. So we'll take the feedback that you all provided us back. Some of it is the same that we've heard in other states too. So Jason and I were on a call right before HIMAC started and said, oh, that's crazy. This just came up again in Oregon. So states in general are aligned. And so it'll be great to be able to tackle some of those in 2027 and beyond. I think in addition to that, we talked a lot about sustaining involvement, and I know that I'm annoying and I will never not bother OHIM or OHP, but that now includes the agent and assister families. And so I think Jason and I are also taking back with SEMA, our product lead again, to evaluate if we can come back to the small group of agents in particular and see if we can meet on a regular basis, whether it be quarterly or biannually, to just flush out some ideas with you all. We just really enjoyed our time, and it was really helpful to get a quick group of people who could very readily provide feedback. And so would love to continue that engagement with you all. So yeah, I think everything is going really, really well. July is big on CMS. We are really close to being really set, and then we can work towards that soft launch activities.
So Claire, what I'm hearing is that we're also first with the usability.
I know, you still get the gold star, and that's important. So yes, great job, Oregon. I think it's been great to work with you all, and great to be able to expand the bubble of Oregon to include the folks that are touching consumers every day in terms of support.
Thank you, Claire, and thank you, team, for the SBM project updates. And if we haven't said this enough, thank you especially to our community partners and our sisters and agents who have given us feedback throughout the last couple of months and definitely the last couple of days. We love it. I think we hopefully we've been clear about it by now that we really appreciate your participation and look forward to partnering more in the many weeks and months to come. Okay, Nishoba, I think.
Yeah, next slide. I don't know if there is anyone joining us virtually looking to contribute via public comment. Hold a few seconds. I don't think there is anyone. I'll pass this over to actually a little bit of look on some of the group rate filings.
Hello, everybody. My name is Tasha Sizemore. I am the Life and Health Product Regulation Manager at the Division of Financial Regulation, and I am here to chat with you all about the individual and small group rate filings that came in June for 2027. Go ahead and advance the slide. Today, I'm actually going to skip the high-level rate review process generally and just talk really briefly about it because I know folks are behind schedule. And then I'd like to talk a little bit about the rates that were filed and some stuff that we know about those, the rates that were filed, and some changes that we'll see before the rates are finalized. And then I did want to highlight a couple of standard review questions that we look at annually that I will be presenting to a different body in the coming weeks, and I thought it might be interesting for this group as well. Okay, next slide, please. So just as an overview, the division approves, reviews and approves major medical, individual and small group health benefit plan rates that are reasonable and not excessive, inadequate, or unfairly discriminatory. And so we are statutorily, we have a statutory framework for what our rate review can look like. In addition to this language, we have some specific requirements that are placed on us. However, just generally, we want to make sure that we balance the consumer's interest in having affordable and comprehensive healthcare coverage with our role in ensuring that insurance companies remain financially stable. So it is a very delicate balance that we work with. Next slide, please. Awesome. When we look at rates, there are three main components that we look at that contribute to what we call the base rate. And we'll get what a base rate is shortly, but we look generally at cost trend or the cost of providing healthcare, how much utilization trend has happened, so how much people are using different health services. We also look at administrative costs. For major medical health plans, the medical loss ratio caps the administrative costs of health benefit plans at 20%. We do an actuarial analysis of all of this information and make sure that it's fair and reasonable, and all the actuarial assumptions that insurers have submitted to the division for review are reasonable and in line, and that we agree with the assessments and assumptions that insurers have made. And out of that conversation, out of that actuarial analysis comes the base rate. And the base rate is what we'll be talking about today in terms of what insurers have filed with us. And that is just the amount before any additional costs due to tobacco usage, geographic rating area, I think that's it, are added on top of the base rate. So next slide, Dawn. So what was filed with us? I put the link below so folks who are interested can go to our website and review the full rate filing on our website. However, for the individual market, the base rates that were filed with us were for 4 insurers. As I'm sure this committee knows, Providence Health Plan and Pacific Source have left the individual market for 2027, or are leaving the individual market for 2027. And so the lineup is much shorter than it has been in previous years, but we are excited that all counties remain covered by at least 2 insurers at this point. So Bridgespan, which is a sister company to Regions Blue Cross Blue Shield, Kaiser and Moda were who filed with us this year. And the rates that were filed with us came out to an average rate request of 17.5%. However, we know that all of the insurers in the individual market left some specific calculations off of their rate filings, or they were not completely correct. So we are going to have to recommend adjustments. So the things that we know from reviewing the rate filing, and this was discussed in part at the rate meeting earlier this week, are the reinsurance program costs, the exchange user fee, I think is what it's called, And there was one other, morbidity that the insurers brought up needing to be adjusted. So the rates that you see here are just the filed rates. Like I said, what goes out as proposed may look different from this, so I don't want folks to be caught off guard when the proposed rates come out. I'll stop there to see if folks have questions before we go on. Okay. Next up, I'll just briefly go over the small group rates. Providence also is withdrawing from the small group market, so they are not on this list. And United Healthcare of Oregon is closing their block, which had 0 members. So this list also looks a tad bit shorter. The average overall rate increase was 17% for the small group market. So that continues to trend upward. Similarly, there may be things in the filed rates that would need to be adjusted in the small group market. But things like exchange user fees are not applicable to small group market. Next slide, please, Dawn. One of the things that we review, and I thought this would be really interesting for this committee to look at, is one of the things that we review as part of rates are what are called the standard review questions. And these are questions that we send out or provide to insurers before they make their rate filings that we feel are important. And these represent key issues, either legislation or things that may result in cost changes in Oregon. And we look at the responses that may indicate a difference in thinking between insurers, and it allows us to see if we need to try to bring the market together or try to increase market understanding or our understanding of the market so that we can be better informed as regulators. And then from a practicality standpoint, the standard review questions reduce the number of last minute objections that we see from, or that we have to give to insurers. And it provides consumers who would like to review the rate filings along with us the opportunity to look at those responses early on as well. Next slide, please, Dawn. We look at these standard questions as part of the rate filings rather than former binder filings because they have possible downstream rate impacts. These could be new coverage requirements, prescription drug rebates, or disease outbreaks. And carrier responses provide valuable information about the services, which is part of that cost trend that I kind of breezed over earlier. And then also rate filings are more publicly available, as I mentioned, so consumers can follow along with us. Next slide, please. We currently use the standard review questions in the division in a couple of ways. As part of internal rate discussion, obviously, including confirming market details, enrollment changes in the market. We've recently included a question about the uptake of $5 primary care visits and the possible rate impact so that we can monitor possible rate impacts on that. We also monitor individual vaccination status and federal vaccine policy changes and its impact on our market. And then we monitor trend and spend in 6 specific care categories. And we're going to look at 2 of those categories in just a moment. Next slide, please. Okay, so I picked 2 questions for folks from the standard review questions to share with folks today. And one of them is question 6, which is what is the organization's total spend on telehealth? Because I think this is interesting, and we did see some shifts from before the pandemic. And then during the pandemic, we saw a huge uptick in the overall amount of telehealth used, in some cases between 50 and 75% of care with telehealth during the pandemic. And that has gone back down to more reasonable or more expected levels that may be a little bit over what we previously saw. So as you can see, the total claim dollar amount, just because of the size of the insurer, varies quite wildly. However, the overall claim spend is actually fairly in alignment, or in kind of close proximity to each other for each market, maybe with a couple of outliers. But I thought that was really interesting from kind of the cost perspective and consumer experience perspective, how much money is actually going to telehealth. Next slide, please. The next question that I wanted to share with you all is one of the trend and spend categories, or two of them actually, prescription drug and preventive services. However, overall at the division, we look at 6 categories of care to see what an insurance company's overall spend on those categories are, to look at the cost trend over time and see if something is increasing in a particular area or decreasing in a particular area. In addition to prescription drug and preventive services, we also look at mental health care, substance use disorder services, inpatient hospitalization, outpatient care, not including emergency care, and then separately we look at emergency care. Next slide, please. Okay. So this is the individual market and the trend and spend for prescription drugs and preventive services. So I put the carrier information here. This is public information, and all of you are welcome to go in and look at the details for the other categories for insurers. I think it's super interesting. And if you are wanting to cut back on the subscription services in your life, this is free and it could provide a lot of entertainment for folks. However, I did think it was interesting, not just the amounts that you see on the screen, but for like prescription drug, the percentage of overall claims that are attributed to it, I thought was really interesting, as well as the fact that preventive services provide a lot of benefit for overall population health, but represent an overall small amount of the claims percentage for the individual premiums. We do ask insurers for noticeable utilization changes, just because they have access to more data than we do and may be able to point something interesting out. I did include that information here. Bridgespan indicating that both Bridgespan and Regents indicating that they saw an increase in use of preventive services overall. So I thought that was really cool to see, and hopefully long term, like I said, it will result in better population health overall. The prescription drug category is always very interesting, but I don't want to spend too much time on it because my prescription drug counterparts aren't here. But if folks would like to discuss that, I can would be happy to discuss that separately as part of our rate filings, and then also loop in some of my colleagues that can maybe help provide more insight into those categories. Next slide, please. Dawn? This is the same information in the previous slide for prescription drug and preventive services, but for the small group market. So for folks who are interested in the small group market, that is out there for you all to go look at. Next slide, please, Dawn. For those of you who are wanting to look at the rate data, although the comment period has closed, you can still go hang out on our website and enjoy all of the lovely materials from the insurers, as well as a recording of the rate meeting that was held earlier this week. And that link is provided on the slide, and my contact information is there as well. Does anybody have any questions after that extremely abbreviated presentation?
Sorry, let me start over. So thank you, Tasha, for your presentation. This is Chicky. We have two questions, one in the chat and then one Stacy also raised her hand. So if we can start with the chat, please. Eileen Jeffries, who is an incoming HIMAC member, asked, the factors you just listed, which is a few slides ago, that will impact the final rates, will they all make these proposed increases go up?
I don't want to say that for sure, but possibly. We haven't fully looked at all of that information, so the actuaries are still working on that data.
So just, I might not have fully understood you, but what I got from your statement was that the insurers have made their proposed rate increases, and you are saying that these are not finalized in particular because there are some considerations that they did not include in their calculations.
In their initial
so they
rate
kind of have to go
filing,
back and make sure that they're considering those factors as well.
Yes. Yeah.
Okay, got it. Thank you.
And then we have Stacy. Yep. Thank you. Thanks, Tasha. We have Stacy in the room with a question.
Yeah, thanks, Tasha, for going over this. The slides are really tiny, and so I was just wondering, on the pharmacy, do you look at specialty specifically, what those cost trends are year to year? I just can't see it on my phone.
We do not look at specialty cost trends specifically outside of, I don't think, I can go back and ask the actuaries, outside of just asking an insurer to call out specialty drugs specifically. But there are other teams within the division or the Prescription Drug Affordability Board that do look at specialty drugs.
I just think it would be interesting because there's so many new specialty drugs coming through the pipeline, like a lot. And I keep hearing that it's driving the majority of the pharmacy spend. So I was just curious, but thanks for clarifying.
Stacey, I can send you the full slides if you would like.
Okay, thank you.
And Stacey and everybody, I do want to just offer the insurer's responses to the standard review questions are publicly available, and if folks would like those to see what we are seeing, I can also make those available and have Chicky help me get those out to folks.
So I don't see any other hands. Oh, I don't see any other hands up in the room or in the virtual room. So thank you so much, Tasha. We know it's a very busy time, so appreciate you sparing us at least half an hour of your time to explain everything to us. So good luck to you and the rest of the team for the rest of the rate filing season. Appreciate your partnership very much.
Thank you. Have a great day, everybody.
So before, let me pass the mic back to Nishoba.
Yeah, before we break for lunch, I wanted to just invite and welcome Bill Kramer as our liaison from the OHPB. Had a couple of updates for us, perhaps. Welcome, Bill.
Hi, thanks very much. Thanks to Cheeky and your team and the advisory committee for your work to keep the health insurance marketplace a viable option for Oregonians to get affordable coverage. And also thanks to Tasha, if she's still on the call, and her team at DFR for this informative presentation. I have just a few quick comments. First, I recognize that our marketplace and our health insurance and healthcare system generally is under a lot of pressure. And there's a lot of uncertainty. And despite this, we need to forge ahead and always keeping the interests of the marketplace enrollees as the first priority, and appreciate all the work you're doing to make that, to keep moving forward even in this challenging time. Second, though, I have to express extreme concern, and I'm sure you all are concerned as well, about the very high rate filings for 2027, 17% on average on top of what are already very high premiums. And this is going to make our healthcare affordability crisis even worse for individuals and small groups in the marketplace. As you probably know, the Oregon Health Policy Board is considering a number of proposals to tackle the affordability crisis. This won't be easy, either policy-wise or politically, but we can't let this go on unchecked. And speaking for the Health Policy Board as a whole, we really appreciate anything you can do, all that you have been doing in your roles to make healthcare and health coverage as affordable as possible. So thanks again for all that you do. Appreciate the opportunity to make a few comments.
All right, thanks, Bill. I think with that, we'll break for lunch. Seemingly, we're a couple minutes behind schedule today, so if we could get folks to return back in 15 minutes, that would be really helpful. We can call that 47?
47. Yes.
Sounds good. 11:47. I appreciate everyone's time. Thank you.
We're all unmuted and all ready to go.
All right, welcome back, everyone. Pardon some of the background noise as we'll make this a little bit of a eating and work meeting kind of collab. But so pardon the noise. I know the microphone is very sensitive in this room. We'll try to mute when we're not speaking. But I'll move us right into our next section. Welcome, Kate and Dave. The little bit of the strategic planning workshop. Thank you, Kate.
Hi, everyone. Katie again. I'm actually going to hand it over to David, who is our wonderful contractor who's been helping us with this work, and he will go ahead and take it away.
Great. Thank you, Katie. And good morning, everyone. Happy to be here with you again today. Just by way of reminder, David Simnid, working as a consultant with the marketplace on developing the strategic plan. And so I'll go through the first few slides here really quickly, just as, again, sort of as a reminder. We're really looking at, this is sort of built on the Oregon transitioning to a state-based marketplace, but the strategic plan is really sort of forward-looking after successful landing of the new SBM. So as we're talking today and putting the plan together, we're really sort of assuming that the transition goes smoothly, and that we're in a good place to sort of build on over the next 5-year period. And we're coming regularly to meetings like these and others to make sure that, as we build the plan, that it's informed by you all, that it represents the community needs, et cetera. So that's why we're coming back again, and you'll probably see me again before the plan is finalized. Okay, next slide. So this is the process. We're really in sort of this June, July piece, sort of in the middle of sort of where it says May partner review of draft framework. So we shared the draft framework with you all. I heard from a number of you via our survey. Much appreciated on the comments and suggestions that you provided. And so today is really to take sort of a closer look at some of the things that we heard from you and others in terms of where we're at with the framework, and where we still have some work to do, and fold into that the full strategic plan, which we're planning to have sort of back out to you all in its sort of final draft form, targeting September for that. Next slide. All right, so I wanted to really focus today. So if you've had a chance to look at the draft framework, you will see in there that it outlines goals and strategies and measures for how the marketplace, what the marketplace will do, why they're doing it in these particular areas, and how that will be measured. And so one of the things that, one of the primary things really that we heard in terms of feedback on the framework is really sort of, it's an opportunity to refine some of those measures. And this is really part of the process anyway. We got those out there in terms of, places to start the discussion. And so as we go through this, I'm going to go through each of the 4 goal areas we'll have in front of you. The different, we won't spend too much time on the strategies today, but really looking at sort of what the goal is, what the sort of rationale for that goal or the things we're trying to do, and then how those will be measured. And I really want to talk about the measurement part in some detail. So as we're looking at each of these, and I'll have some specific questions on each of the slides, but just in general, as you're thinking about the measures, be thinking about like where this data will come from, what our state's current performance is, so baseline, and how we would identify that, what success might look like. So what might those measures look like if we're successful, and what improvement would be meaningful. So in other words, you can't, go from point A to point B overnight. So thinking about some strategies to try to help move you from that point A to point B, and in between there, hopefully there'll be some some sort of marks or some steps that would demonstrate that the strategies are working, and that they're meaningfully improving where we're at today, and where we're trying to get to. So keep those questions in your mind as we go through each of these. Next slide. So a little more on the measure as we go through each of these, thinking about, is this a good measure? Does it seem to reflect what we are trying to accomplish? So if we're measuring something, we want to make sure that it's reflective of the objective, and that we're making progress on that objective. The data, obviously, we need to have data to drive that, and we want to be thinking about, is this something that exists today, or would we need to develop either data sets or reporting structures or whatever that might look like? Do we have a baseline today that as our starting point, or is that something that would need to be built? And then again, sort of what does success look like? And so thinking about, how do we identify benchmarks? So if there are national standards, or if there are sort of peer states that are doing similar things or are in similar places, then where are they at? Are we able to tell that? So those are a couple of things where we could identify some benchmarks. All right, let's go ahead and go to the next slide. Let's see. I think at this point, I'm interested in us having a discussion, so I'm going to kind of orient you to this first goal area. But if at any point you have questions or comments that you would like to make, then please raise your hands and or alert me in some way so that I can pause, and we can talk about those questions or comments or ideas that you have. So first goal for the strategic plan is to make coverage affordable, understandable, and valuable for Oregon residents. And so a couple of objectives that have been identified here around this are to mitigate premium and cost sharing increases for consumers, and to improve consumers' ability to select plans that meet their needs and avoid unexpected costs. So some of that planning. And the measures that have been identified here are looking at the average net premium income band compared to national average, so standardizing it in that way. Looking at the marketplace's enrollment growth and retention trends. So how many people are joining or dropping out each year, and identifying how those change over time. Utilization of primary and preventive services. Size and growth of the marketplace risk pool. And then a survey-based consumer reported understanding of plan selection and use. So, do they feel informed, and are they making choices based on that sort of knowledge or education? So the first discussion question here is, do you feel like these measures are sufficient to tell us whether coverage is affordable and understandable? Are these getting us to that, or are there other measures that need to be identified? What do you think here?
I have a question.
Please.
Stacy in the room. I guess where I'm struggling a little bit with this one is, how do we define affordable? And if that's defined somewhere and I missed it, let me know. But that's tripping me up here.
Yeah, no, I think that's a great question, and would look to you and others to sort of provide some input about what that could mean or should mean, or factors that should be taken into account to sort of get to but it's right. I mean, obviously what's affordable for one might not be affordable for somebody else. So do you have ideas, or do other folks have ideas about how we get to a good definition for affordable?
Marin, I realize, just a comment or a question, but is there a percentage in terms of how much we spend on insurance, like housing, that have been developed by, I don't know,
There is,
experts?
yeah, Matthew Woodbridge. So there is the federal affordability standard that went into
Uh-huh.
place with the ACA, which was 9.65%
Of your
gross
income? Should be.
Yeah, so that's the measure used by the feds to determine whether a group plan offered to an employee is affordable. So there is a federally defined number.
But it's for a group health plan, is that?
Well, it's used to determine whether a plan meets the standard definition of affordable when offered to an employee, which is used to determine their eligibility for tax credits on the marketplace. And then that is also roughly the number that the marketplace is targeting with the subsidies on
When they calculate the tax.
What do they call that plan?
The benchmark plan.
That's the word, yes. Thank you, Kate. The benchmark plan.
So basically, Matthew, somebody's making, let's say $50,000 a year, and they're spending 15% on healthcare. That's not sustainable, affordable, or?
It depends a little bit. There's a little bit of variation there because if they've chosen a gold plan, that's a more expensive plan than what the benchmark is. So they're targeting the benchmark silver plan, so mid-tier plan at 9.65% of roughly 9%, 9.5%, 10% of gross income as what they consider to be affordable. And they base the subsidies on that, but then the consumer can choose to apply that to the gold plan. So they might be paying 15% by choice, but is there a plan available to them that meets that 9.65 is what the.
But only doesn't cover what they want. Does it cover what they are looking for?
Well, so that's where the personal choice comes in.
Because it doesn't cover it, then I have to spend money from out of pocket to cover all the other costs.
Yeah.
That affects my income.
Yeah.
Anyway.
It is a definition that would, I feel like to do this metric, you need to have a clearly defined definition of affordable.
Yeah.
So that we're all on the same page. So that would be one option. I mean, I think that's a good one.
Let me, can I throw something out at you in terms of, so this is a super helpful discussion in terms of sort of framing what is affordable, and then some of the choices that folks are making where they might choose to spend maybe a little more than that or maybe a little less than that. So, and that's different for every person, and the subsidies obviously are going to be different based on those things too. And so I am a question. So we have this enrollment growth and retention trends as one of the measures. And so if you think about, people's actions reflect whether they're sort of viewing it as affordable or not. Do you think that measure would get to this affordability question without us getting into sort of the nitty-gritty of percentage of income and those types of things? So if you see, for example, if you saw enrollment sort of stay stable, then I think you might be able to make an assumption or a statement that says, that it hasn't gotten any less affordable, right? So we've sort of maintained, if we're maintaining enrollment, then maybe it's reasonable to say that also means we're maintaining affordability. And then sort of retention, the increases or decreases would also sort of feed into that in terms of, whether that's affordable or not. There's lots of other factors of why people enroll or disenroll. But that might be one where you could just stay sort of in the measure itself and not have to get down to nitty-gritty of an affordability definition. Just an idea.
Personally, so this is Stacy. Personally, I don't think that the enrollment numbers is an indicator of affordability. I think that if you have a health condition, you don't really have a choice. You're having to do this.
Yeah.
So, and it could be unaffordable. Yeah.
Like if, a car increases in price by 20%, you could just choose to buy a less expensive car. But if you don't, first of all, if you don't have a choice and much choice in what kind of health insurance you have, and you need health insurance, you're just going to keep absorbing those costs, even if it's not affordable to you. You just have to cut something else out of your budget.
Yeah. Is this, would this be data? So we don't have this identified, but is this data that would be available or could be available in terms of people's reported income versus the amount they're paying for premiums? Do you have that information today? Or would you have it under the new SPM?
Well, under the new SPM.
We will have it. I would just note that with the elimination of the enhanced subsidies, folks over 400% are no longer eligible. And so they will see like significant increases. And so you'll just see a cliff. You'll see the folks between 200 and 400, and they have different levels. And then over 400, it's just subject to whatever they make and whatever the cost of the plans are. So that instantly becomes kind of unaffordable for most folks.
So you would know that they were 400% or above, but you wouldn't know how far above necessarily. Is that?
We might know how far above, but there's just no cap for them like there is for the other folks. So because of the way the tax credits are, it's difficult to try to control affordability. You have to do it like sort of at the market level versus the folks who get subsidies. There are some other levers that control affordability for them.
Gotcha. Okay. Elena?
Hi, this is Elena. My only question was, I guess it's two questions in one question. So in a strategic plan, it's a great goal to make coverage affordable, but I didn't see a plan on how Marketplace is going to do that. Like a step-by-step plan, like, okay, I understand the objective to mitigate premium and core sharing increases for consumers, or compare average net premium income to national average. It's just where I was looking for a plan, like a step-by-step plan. And another thing is that I don't see how comparing net income is relevant to us, to Oregon, because I'm asking because like Oregon has one of the highest income taxes and other taxes as well, and if we're also getting a toll, then people are gonna get more worried and more nervous and etc. So how can we help people? How can we help make coverage affordable, right? Maybe include, not look at the net income, but what's it called? The income after the taxes. Because like, for example, for my family, it's like I'm on Marketplace. Like what my husband and I get on paper is one number, but what we get like actual to our banking account is like super, the number is much slower because Oregon's taking a lot. So is there an option for the health insurance Marketplace to consider that, and also maybe help people to make coverage affordable considering that? I don't know, does that make sense? Like considering the tax and considering other bills, like I think somebody said rent, car, what else? And we have so many bills. It's like 60 right now. Bills are taking 60% off from our paychecks. It's like average. So sorry, just with my discussion, and then also a question. I don't know. Just I was looking for more in that strategic plan.
Yeah, and one thing to that question. So I mean, it's just a framework at this point, and doesn't even represent the full framework because there are a number of strategies, which I think Elena is one of the things you're suggesting we need here. So there are a number of strategies that are in that broader framework that I'm not focusing on today, but they're there. So you might go take a look at those and see if those are making sense to you. The other thing I was thinking in terms of, affordability and looking at, what levers does the Marketplace have? What authority and ability does the Marketplace to have to directly make things more affordable? And it might be limited. So, those strategies, things that cost additional dollars for the state might not be an option. And then on your comments or questions on the measure, I don't know if there's anyone else who has any feedback on that average net premium income band compared to national average measure in response to Elena's question.
So this is Katie. I would just say one of the things that is problematic about the affordability calculation that goes into tax credits is that it's just one number for the whole nation. And so it doesn't include cost of living, and it doesn't include those factors that you mentioned. And so that is, something that we struggle with. And if we were able to do some sort of state subsidy, that would allow us to kind of mitigate some of those factors, some of those things like you mentioned that, just because you're making a number on paper after you've paid rent, after you've paid all your bills, that number is often less than what is sort of estimated by, your income.
And I think especially for small business, people may be looking at this, but in reality, after everything they expense or whatever is over with, and then it's probably not affordable, and you have to pay, like she said, a lot of taxes on whatever. So yeah, it's tough, really tough.
So this is Stacy again. I think affordability is an aspirational, beautiful goal. I don't know how we're able to really address that. I think what we could do is refine this to say, ensure there's affordable options available, because I believe one of the things that we're doing is getting people based on income levels to the right place, whether that's Medicaid or the bridge plan, and maybe that's a way to kind of twist this and make it something that we could achieve. And then you're talking about enrollment into those various plans or options. So it's just an idea.
Okay. Yeah, Paul.
Thanks, and maybe a slightly dissenting view from Stacy there, or like aligned on the reality, but I do kind of prefer, like, our goal should be make coverage affordable. And maybe it's the A to B problem that David mentioned, that no, that actually reaching pure affordability in the short run is probably unrealistic. And it would be, hey, do we have more affordable options? Is at least less unaffordable? Like, as hard to celebrate, but I think would be steps in the right direction. But I would still want us to target, hey, we want something to be meaningfully different here. And I recognize, in this spot on the marketplace, we don't have a lot of levers, but I do think helping coverage be more understandable is something we have a lot of influence over and could increase the size of the market. And if you increase the size of the market, you do tend to bring premiums down because you get people in it that aren't actively using coverage. Just, the way an insurance pool is supposed to work is that you have both the people that need it and the ones that are just there because they see some value and some protection. And our challenge in Oregon is that the marketplace has shrunk like 7 years in a row. And so we're really just getting the people who need it, which is good. But it sort of goes against how do we get more people covered and protected and all of the good things that the exchange can do.
Thank you, Paul. Okay, I'm going to, so we've got 3 more to cover, and I want to dive into a couple of specific things on each of these measures. So I'm going to move us along, and then if we have time at the end, we can come back to any of the goals. So if we can go to the next slide. I want to take a look at each of these measures and ask you all to categorize them using the categories here. So this is looking at sort of the data for each of the identified measures. Would that be available now? Well, I guess first off, is it a good measure? Does it make sense to you to collect this or to collect it in some way? And then if it is a good measure, is the data available now, either readily available or with some fairly reasonable or easy tweaks would likely be available? The next category is the measure needs some refinement. We'll if you identify those, we'll talk a little bit about what that means. But it's, it's sort of the right concept, but needs some changes. And then the third category is really, maybe there's a missing measure or a gap that we're going to miss progress or lack of progress towards this goal if we're not measuring some other things. So let's just start here at the top. We've talked about this one a little bit already, but the average net premium income band compared to the national average. Would you all say that's a 1 or a 2? Or I guess we could put that, we could either have missing measure or, this is a measure that really doesn't make sense to track. What do folks think? And if folks want to just sort of call it out or put it in the chat, what you would rate either any of these, that would be great.
This is Matthew here in the room. I mean, I think that comparing to the national average is reasonable. It kind of tells us where we are versus the overall trend for the country, which, gives us a little bit of direction. I mean, we know what direction the country is trending and what direction the state is trending, and whether those are, are we outpacing the state in costs? Okay, something's wrong. What's going on? We really need to look at this. Or are we increasing slower than they are? That's maybe progress. It's not as bad, but so I think comparison to the national average, I think is a reasonable factor there.
Okay, great. Any other thoughts on this, or just dissenting thoughts?
I think it needs refinement. I mean, personally, I think it's okay to start there, but it goes back to, I don't know how that's going to give you the whole picture of affordability for Oregonians.
And are you talking about the goal overall or this specific measure here?
I think this measure is the only one that has anything to do with cost when I'm looking at the measures. So for me, that's the only one that's going to tie to affordability. And that's why I feel like it needs refinement. Or you could just, it could be good and you are missing a measure. I mean, I'm not sure.
Okay. All right, let's go ahead and move to the next one here. Enrollment growth and retention trends.
That's a good one.
Okay.
Give that a 1.
Great. All right, utilization of primary and preventive services.
I mean, that definitely goes to people having coverage and understanding it, if they're utilizing it for the primary and preventive services. Data is readily available.
Did you say the data is readily available?
I would think so. I mean, we know that DFR gets some of that data right at the end of the year from an earlier presentation here. So I think that Stacy can confirm for us from the carrier side that they're tracking that data all the time.
Yeah. Easy.
Okay. Size and growth of marketplace risk pool. So I'm guessing this would be the data would be fairly easy to get. Is that true? And so assuming so, does this make sense in terms of sort of evaluating how the state's doing on this goal? Okay. And the last one, consumer reported understanding of plan selection and use.
I think that's good. Do we have a survey today? I mean, no, so this would have to be created.
Okay.
It's something that's going to be in development very soon.
Okay, good. Okay.
We've surveyed folks before in the past, and also the Oregon Health Insurance Survey is being fielded right now, but we have input into that as well. So we have some currently existing survey options, and then, as Amy said, we will be developing more marketplace-specific survey options.
Great. All right, let's go ahead and go to goal 2. All right, so this next one is really looking at transitions and continuity across programs. And this is really looking at, in both directions, but marketplace to OHP to OHP bridge and back around again. So the objectives here are reducing coverage lapses between those three different areas. Improving consumer understanding of coverage transitions and responsibilities, what they're responsible for, what others might be available to help, et cetera. And then increasing successful gap-free transitions. Measures identified so far are rate of successful transition without coverage gaps. I think that second part's probably the primary way that you would measure it. No gap in coverage, but maybe there's ways to get at the successful part too. Marketplace enrollment rates following OHP or OHP bridge exit. Volume and resolution time of issues related to transitioning to marketplace coverage. And another survey-based measure here, consumer understanding of eligibility changes. So questions or discussion, as we look at sort of continuity of coverage as one of the objectives here, which measure do you think would best sort of indicate that we had sort of a successful continuity of coverage? And I think that the next question is kind of, it's related for sure, and thinking about, what data do we currently have, or will we have under the state-based marketplace to show, that we have good continuity or that we don't.
This is Nishoba in the room. I personally think that the last two measures, the volume resolution time and the consumer understanding survey base, are much more successful at even identifying this continuity, because the first two, in my opinion, they can be directly attributed to cost and affordability again, not to bring our conversation back to that. But the lack of enrollments post OHP or bridge is directly attributed to cost most times, in my opinion, in my experience. So I think that we need to gather attestation, right, survey, or look at some of the resolution time, communication, and those processes between these programs, like this second. But yeah.
This is
okay.
Room too. I do think that for people who do enroll, who do exit OHP or bridge program and then do enroll in marketplace coverage, I think measuring that gap time is an important factor, because there are going to be people who don't enroll because of the affordability aspect, the cost aspect. But for those who do enroll, I think it is important that we're aware of what that gap time is, and we're minimizing that gap as much as possible, because if they are enrolling, then that gap matters.
Yeah, I think that's a good point. And I think, one of the other things to keep in mind is that, as we're looking at this as sort of a population of people, and sort of how things change over time, that can be really telling of how well you're doing, or where you have opportunities for improvement. And so, the point about, people are dropping off if they lose, eligibility for OHP or OHP bridge, and then they just sort of disappear from coverage altogether, is an important one, and definitely something to work on. But it is helpful to know, as I think Matthew, you were saying, that how have you done in the past? What's the baseline for getting these people? Like, enrolled in the marketplace, and then how are you doing in the future? And is that staying stable? Are you losing more folks than you had before? And what might be driving that? Or are you gaining more folks that are successfully making that transition? And what might be driving that? Any other measures that you think would be should be considered here to as an indicator for this goal? Okay. How about data sources? Does this feel like we would be able to pull this reasonably easily with the data and data sources that exist today, or with minor modification like the survey, for example? Like if we have it sounds like there is surveys that happen already, could be added. It's not necessarily available today, but could reasonably be added to be an indicator on this measure. Any of these that seem like they would be difficult to get the data that would be necessary to fill out the measure?
A quick comment, David Marin. Have we surveyed if people understand exactly what to cover with? Like, they understand the coverages and what does it cover? What is a copay? What is that? Whatever. Do we measure that, or do we keep data of that, or do we ask that in terms of customers?
Not something that we ask per se. When we do on the Oregon Health Insurance Survey, we do ask people like, what is your deductible and things like that, and then we record if people say they don't know. So we have a little bit of information on who doesn't know, but we don't really measure how much they do know or understand truly about how to use their coverage.
Do we have anything like that for people on OHP or Bridge?
They are asked the same, like the Oregon Health Insurance Survey goes out to all people in Oregon, and I don't know if they ask folks on OHP or OHP Bridge similar questions.
Be interested to see if there was or if we can utilize a focused survey for members of OHP Bridge to assess their understanding of their benefits. We do, I mean, you like Maureen, I'm sure you've experienced it in the show as well, like folks who are on Oregon Health Plan who just don't understand what that means.
Have no clue what their
card, and I don't know what it covers.
Yeah.
We get questions all the time. And it has changed too over the last 5 or 6 years. What those benefits are have shifted too. So I don't think there's solid understanding in the community about those thoroughly.
So it sounds like that is one that doesn't really exist today.
Yeah.
There you go. Needs refinement.
Right, let's go ahead and go to the next slide. So same drill here. I think what I'm hearing based on our conversation here is that the 3 and 4 are definitely ones. 1 and 2 maybe fall, measure 1 and measure 2 maybe fall between like a 1 and a 2. Any dissent to that, or any other thoughts? Okay. And then I didn't hear in terms of like, other opportunities that we have for measures or metrics on this particular goal. Okay. All right. Let's go ahead and go to 3. All right, so goal 3 is to strengthen the partners and the systems that support enrollment and retention with objectives of improving partner efficiency and effectiveness, reducing administrative burdens on partners, improve issue resolution, and having clear escalation pathways, and then strengthening pathways that connect consumers to enrollment partners, so that folks can get that help that they need and do it in a seamless and early way. Measures that have been identified are looking at enrollment partner satisfaction, time it takes to resolve a partner-initiated issue, how frequently and often and effectively, I suppose, partners are using tools and portals that are provided, and then partner-supported enrollment and retention outcomes. So, thoughts or discussion on or questions on any of those?
I do. Hi, this is Stacy in the room. So one's a question. Do we have the survey for the partners satisfaction? Does that exist today?
Yes, I think so.
So it goes out to carriers and to brokers.
The question is a survey to partners, satisfaction survey to partners. I believe we have a survey for agents, and we have a survey for assistants.
Yeah, we actually just, I think Brandon sent it out last week or the week before.
Yeah.
Let's go to carriers. I guess
For the assisters.
Katie, you have an answer?
Like a survey, like, I mean, I talk to carriers all the time, so
a satisfaction survey, just so that everybody, as far as a partner, I would consider a carrier a partner.
Sure, yeah, I can make a satisfaction survey.
I don't know. This was, yeah, I was wondering if it existed. I didn't see it.
I'm always happy to take carrier feedback in any form, but I would be happy to create a satisfaction
Just to
survey and send one out. Sure.
Come back through to this thing. And then I guess I feel like there's a little bit more specificity that's needed for some of these measures. So time to resolve issues, like what's the expectation? Just let's pretend it's 3 days. Okay, just say it's 3 business days. So is the goal 90% of we should be hitting 90% within 3 days, and then that's what you're reporting on to say we met the measure or we didn't. Otherwise, it just seems a little vague to me. So
I think that if I'm understanding the framework, we're looking at the overall framework right now, if I'm understanding this correctly. We're identifying what things we want to measure, and then when we get deeper into the specific strategies, refining what the specific targets are in that. Is that correct?
Yeah, yes, that's absolutely right. So what we'll do next as part of the either part of the strategic plan development will either be, and it might vary based on the measure, but we'll be developing a benchmark, measurement strategies, and then an improvement expectation, right? So if you have like a 90% of something as sort of your benchmark, then you would assess through the baseline where you were at today, and so maybe that's 50%, say, and so you need to figure out sort of what's meaningful improvement over time to move towards that 90% benchmark. So yes, those will absolutely be part of the strategic plan. In some cases, we may actually include specific benchmarks and improvement sort of benchmarks or movement as well. And in other cases, it might be that would be some of the first steps in, sort of year one, maybe on some of them in year two, to sort of establish what those benchmarks are, and then start measuring and assessing progress.
Thank you. That's very helpful. And I guess the last one I didn't understand. So the partner supported enrollment and retention outcomes, like what does that mean?
So I think, and maybe Katie or others, OHIM folks can help with this, but I think it's really looking at, sort of education that's provided to or by partners to consumers on enrollment and how to enroll, and then looking at what that retention looks like. So, and if people are moving from some sort of partner supported education or support, some sort of support, are they moving into actually enrolling in the marketplace? I think that's what it's talking about.
I can say, this is Misty, sorry, I can say it also probably speaks to like how many are retaining and keeping their agent, right? And how many, and some that maybe are like, oh, I can do this myself, so I don't need it. So we can see the stats on how many are attached to an agent and how many are also attached to a Canadian partner for that support.
And I think this is Matthew. I think when we talked about this last time too, one of the other factors we were considering is where we're talking about enrollment and retention outcomes. We're talking about, one of the factors was looking at the population of consumers who are enrolling in a plan with the assistance of a partner, whether that's an agent or an assister, and keeping their plan throughout the year and utilizing it versus those who enroll without that assistance and keep it. So looking at the percentages of successful year-long coverages in those populations comparatively.
Yeah, that's right. That is part of it, part of what we had talked about. Thank you. Other thoughts or questions on any of these? Did the discussion question that I had identified here is looking at you know, is there a measure or two here that you think would be most indicative of sort of a strong support system for partners? What would be sort of our best indicator or indicators from these measures here that it's working?
Matthew here in the room, I think the two that stand out to me as far as measures is the time to resolve partner-initiated issues and the partner-supported enrollment and retention outcomes. What those say to me, the time to resolve says to me, you know, the shorter that time is, the more the system is responsive, the more the infrastructure and support is responsive and focused on fixing those issues. And then the enrollment and retention outcomes tells me how effectively we have educated and equipped our partners to support the consumers. The better the consumer, you know, the partner-connected consumer's outcome is, the more effective that partner has been. The more effective that partner has been, the better we have done our job in supporting that partner and educating them and enabling them to do their job efficiently.
Great, thank you.
Yes, hi. I'm speaking as a partner, so all the measures are good. I think my number one would be partner-supported enrollment and retention outcome, and the portals, using the portal, and agree with Matthew on time to resolve partner-initiated issue. That's it.
Great, thank you. All right, any other thoughts on this one? Otherwise, we'll jump into our last area here. So I think we can go ahead and skip this and just go to the next slide. All right, goal 4. Advance equity through culturally responsive access and quality, with the objectives of being increasing enrollment in communities of focus, improving language access and culturally responsive supports, and increasing optional self-reporting of RealD information in enrollment applications. And the ways that have been identified thus far to assess or measure that is looking at enrollment and retention specifically by preferred language, race, ethnicity, geography. Next one, access to and utilization of in-language assistance for those who need it, obviously. Adoption of meaningful language access and related quality measures. This is related to, you know, some of the things that the Medicaid plan, Oregon Health Plan uses with their CCOs, and either adopting those or in some modified fashion that makes the most sense to the marketplace. And then the last one here is really on partner and community feedback on how the marketplace is doing. Thoughts, questions? Other ideas on this one?
Maren, I think all the measures to me look fine. In terms of what the marketplace keeps data-wise. Do you guys have all this data right now, Chicky? Or I mean, in terms
some
of
data.
huh?
We have some data. We have whatever data. Healthcare.gov sets the questions, and then folks either provide that data or don't provide that data. And then healthcare.gov, or excuse me, CMS has recently reduced some of the data that they have asked carriers to require. We are going to still ask carriers to provide that data if they have it. So we have a little bit of flexibility. We'll have more flexibility as necessary.
Thank you.
I think that's the challenge with this one. I think there's a lot of holes in the data to report on it.
Yeah, and I think that's Matt here. I think that's why the partner community feedback is such a critical component of this goal. I think that's one of the most important measures we have in this goal, is in particular the community feedback. The partner feedback is really good, but the community feedback is the best we can get for this.
Do you or others have ideas about, specific ways that should be gathered? I mean, obviously that's coming in lots of ways. We talked about on a few of the other measures, some survey-based responses, other thoughts or specific things that folks think that the marketplace should be looking at to collect this specific data.
I mean, Marin, by the way, on the reporting, I guess that CBOs report monthly in terms of what that is. That could be a way to capture that data with stories or, I don't know, anecdotal information.
Matthew here, we have, the marketplace has already done a few of these over the years where they do a community panel, where they literally do community feedback panels out in, they've been focused mainly on underserved or rural communities, but doing them in cultural communities as well. Those panels have always provided a wealth of feedback and information on the consumer's experience from their perspective and their cultures.
So, that makes sense, and there's definitely I think a way to get at this information. I'm thinking in terms of sort of that data specifically, how you would sort of quantify that. I mean, it would really be qualitative information, but how you might quantify it in terms of, what's the baseline, and maybe you're assessing, sort of doing it right. I mean, that would be something that you could easily track in terms of how often are these sessions happening, and then maybe some semi-objective measure of the tenor of that feedback. I don't know. Does the question make sense in terms of how do you measure that, and how do you show progress?
Do we, Katie, or anyone in the marketplace team, and I guess this Claire is the question too. This is Matthew, by the way. The marketplace system, the state-based system, as we transition, I didn't see in the testing any kind of a feedback survey at the end, but that would be a place when someone is using the system and going through it in Spanish with the language assistance, self-identifies as Arab American Indian Alaska Native or from a particular cultural community. Can we have a survey at the end about their experience in the platform, where they're providing us feedback to a set of questions? How did you find this? Was this, did anything stuff? I don't know what those questions would be necessarily, but since we have a platform, we can, is that something we can implement?
Let me take that back with the team. I think this has come up in a couple different conversations we've had, not only with you all, but with other states. If there's a clean way to collect that feedback, we will solicit feedback on the CAC side, so there'll be a customer satisfaction survey on that end, but it will be a different focus, obviously. I know we do regular focus groups as well with folks across the nation, just to understand what their user experience is with our platform, especially with major updates. But let me see if any other state is currently including this, and just see what we do there.
That sounds great. Thanks, Matthew.
I think the other thing, if there are sort of broad-based experience surveys that you are conducting or will be conducting, and then if you were able to sort of stratify it, so maybe not specific questions related to equity and culturally responsive access, but sort of stratifying it based on folks who were part of those communities. So I think that takes us to through all the goals and measures that I had. I think we're pretty much done. Any sort of final thoughts or questions that folks have?
David, this is Matthew here in the room. Back on goal 2, improving coverage, transitions, and continuity across programs. Something that occurred to me as we were talking about goal 3 is I don't think we have data to track this right now, but with the new platform, we may have the opportunity to track folks who are coming off of OHP and Bridge. What percentage of them are getting connected to a partner? That would be a method of effective, a piece of data we could track as far as effectiveness and easing that transition, regardless of what the outcome is. If we've connected them to a partner, they're not falling through the cracks. They've at least been connected to one of the resources that's here for them.
Okay, yeah, no, that sounds like a great addition. Or we can take a look at what we already have, maybe a refinement of one of those. But I think that seems like if we can get that data, that would be super helpful. So I think in terms of next steps, I mentioned it at the start, but I'm gonna be doing some work with the OHIM folks to sort of flesh out a lot of these things and start to get a good draft, detailed strategic plan put together. Would anticipate that, September-ish probably we'd have a really good draft to distribute to partners and you all, of course, and get some very specific feedback from you before that's finalized. So, and then as always, as things come up or questions or other ideas, feel free to route those to Katie and she can get them to me. All right, thanks everyone.
All right, thank you, David. We appreciate your time and the continued conversation. I just want to open up another opportunity for folks that might be joining us out there. If you had any other requests for public comment. Right, don't think we have anybody today. And so, yeah, if we have any other committee business, I don't know if Chiki wanted to contribute any updates about some of our current staffing or any other updates we might have.
Sounds good. And yes, I do. Thank you. This is Chiki Flowers in the room. So a few items for a heads up for committee business in the next couple of months. So first and foremost, thank you to those that have accepted nominations for the HIMAC chair and vice chair. For everyone's awareness, Neshoba Timberly has accepted the nomination for the HIMAC chair position, and Matt Woodbridge has accepted sorry, I'm giggling because, it was a very robust conversation with Matt. He has accepted the nomination for the HIMAC vice chair. So we will be holding elections at our October 15th meeting. And so any additional information about these nominations should come by email before then. The second committee business, as a heads up, is we are also going to be working on our 2027 work plan for the Health Insurance Marketplace Advisory Committee. For those of you who are new to the committee, there are the 2026 version and the 2025 version should be posted on our website. So we will be working on it and to provide a proposal for you all to consider offline before the October 15th meeting. So hopefully we can get your suggestions incorporated before we all convene again on October 15th to hopefully approve or not approve the work plan for 2027. And then lastly, we do have two new members, or rather members who are being considered by for appointment by the governor and for Senate confirmation. Eileen was able to join us today, so thank you, Eileen, for taking time out of your busy day to join us. She is a small business owner. And then the other member for consideration by the governor's office is JP Cardenas. So you might be familiar with JP because he's been around for quite a while. Definitely in the exchange world in the various states, and he's now a member of Kaiser Permanente. He has submitted his application is being considered as well. So, and hopefully with Senate confirmation in September, they'll be able to join us officially in October. And I believe that wraps up official committee business that I have in my list. I'm looking to Dawn and Victor if I missed anything. Okay, they are shaking their head very professionally. All right, so I think that's it in terms of wrap up. Our next meeting is October 15th. This will be a virtual meeting, and then recognizing October 15th is already busy for many of our agents because Medicare open enrollment would have started, I think, October 7th. Is that correct? Mm-hmm. October 7th is Medicare. PEB and OEB enrollment, open enrollment is October 1st. We'll have our launch by then. So October 15th, hopefully we should also have our plan guide, formerly known as window shopping plan guide. We'll have also launched by then. So it's a busy next couple of months for that, definitely for your marketplace team. And we will provide updates as you might be interested in the next couple of weeks and months through email. But if you have any other questions or concerns before then, please don't hesitate to email us, and we will respond as soon as we can. And I think interim chair and Ashova temporarily, soon to be permanent chair in October. I think that wraps up my section of this agenda.
Yeah, well, thank you, everybody. Appreciate the time, and it was great to meet in person today. Get a good, robust dialogue and see all y'all. See you next time in October. Appreciate it. Thank you, everyone.
Bye.